got called away again. We're here in the Dolph C. Simons Jr. Family Broadcast Studio. I did want to stumble just like he does over the name because I wanted people at home, to feel more comfortable. Before I say my next thing, here's what I need from you at home. When I have to sit here suddenly, that means somebody else is doing my job. So I really need the community to come up with great questions today. Make that job easier for Jessica Lovell, who is now Jill Chadwick this morning. All right. In studio with us is Jody Schmidt. She's Executive Director of the CARE Collaborative. And joining us virtually from the western edge of the scenic Flint Hills is Austin Gillard. He is CEO of the Clay County Medical Center. And from the heart of Kansas, Chief Nursing Officer at McPherson Hospital, Beth Warden. So good to see you guys. Thank you for being with us. These guests today are going to help us share the story of COVID-19 in Greater Kansas and the response that has been mounted by the CARE Collaborative, which is a statewide, clinically integrated network sponsored by the health system, and it connects hospitals and physicians and providers in 66 counties. Really impressive. Let's talk about another number. Dr. Hawkinson, how are we doing this morning?
Yeah, well, I think we're doing pretty good. We have to remember that Dr. Stites does have a full-time job as CMO and also seeing patients, so sometimes that gets pretty hectic.
That doctor thing, it really does.
Making patients better. So today our numbers are pretty good. We have 20 in the hospital, so I think we are really reaching that equilibrium of 20 to 30 right now. Hopefully it won't go up. Obviously we'd like it to go down. We do have 5 in the ICU, so that's 1 more than yesterday, and we have now 2 on the ventilator compared to yesterday. So we did get a critically ill admission, but we also have 35 other patients in the hospital who are recovering, who are out of the acute stage of COVID-19. But again, are still in the hospital because of COVID. So,
and of those 35, are there any that are still on ventilators?
There are 4 that are still on the ventilator. Yeah.
It's really hard to come off the vent sometimes, isn't it?
Yeah, it is. It certainly is. And that is something that we have seen from the first patients that were in the United States and the first patients that we had here. It typically does take around 10 to 14 days. Obviously, sometimes it can be longer than that, too. So.
All right. Well, we thank you for that update. Don't go anywhere.
I'll be right here.
Okay. Jody, let's start with you. Tell us a little bit about what, for people who may not know, what the collaborative is and how it got started.
We started a little over 5 years ago with the goal of connecting the resources and expertise here at the Academic Medical Center with rural providers all across the state. I was a former rural hospital CEO myself before joining the health system, and I can tell you it's a real challenge to stay on top of all of the latest research and evidence-based practice. And so our goal is to bring those resources out into the rural community through protocols and guidelines and localized trainings and support and ongoing education programs. And when research indicates a new opportunity to care for heart attack or stroke or sepsis patients, then we can bring that to our members in a matter of months instead of years, which is typically what happens around the country. And so from that, as the pandemic hit, and we were just getting ready to launch new programs in trauma and palliative care, we said, how can we take that experience and really bring it to bear in this example? And so we've taken the protocols and the recommendations developed here and made them fit for a rural environment and then shared it with our members all across the state. We've worked with the Hospital Association to do weekly clinician calls with Dr. Hawkinson and others, and really done the best that we could to make certain that the information we had as it was coming in, like drinking from a fire hose in the early days, so much information, so much to process. Our members said some of them said we came to the point where there were 2 sources of truth for us, KDHE and the CARE Collaborative. And that really told us that the work we were doing was making a difference, making it just a little easier for our members.
I think it's a great story, and I know that in these rural areas, because I grew up in a rural community too, right? Mm-hmm. And your hospitals are essential, and you know the people that are working there, and they do great work. And I think that everybody that's listening, to learn that you have a collaborative where all the oars are in the water and everybody's rowing together. I mean, that's what we think healthcare is supposed to be as a society, right?
Absolutely.
Everyone
where we can. What's been wonderful about our opportunity when we can go on site and do boot camps is we're inviting all the providers at the local level, physicians, nurses, EMS, long-term care, all the support people, so that everyone's coming together with the same information at the same time. And we have found that that makes all the difference in the world. But through COVID, we've been doing that virtually.
Yeah, well, let's turn to our guests, because we want to hear about their communities, about healthcare, and if they are experiencing COVID, how it has changed the work that they are doing and how they are serving their patients and community. And we're going to start with Austin.
Okay. Well, just a little update on what's going on in Clay Center, Kansas, and Clay County in general. COVID's had a dramatic impact, not only on the urban healthcare centers, but also in rural America, such as Clay Center, Kansas. So to date, there's only been 40 positive cases within Clay County, but our hospital and our staff have taken this very serious since mid-February. So visitor restrictions, everyone's masked up, and thanks to the University of Kansas Health System and the Care Collaborative, we get a lot of great information from your team and also from KDHE on proper PPE recommendations, how to isolate our patients. Do they need to be in a pure isolation room, which we only have 2 of in our entire system, or can we put them into a negative airflow room, which we've developed over the last several months. But visitor restrictions have been pretty hard on our small community. Like you mentioned earlier, Jill, a lot of our patients and employees and community members are really tight-knit. And so when that loved one's in the hospital and they can't see that patient for that illness that they're admitted for, it's been pretty difficult emotionally on our community. But overall, COVID's impacted our everyday life, even in rural America.
Wow, what an update. Beth, what's the story there?
Well, I'm beginning to think that Clay and I are in the same hospital, because what he has said is exactly what we are experiencing. We have a total of 227 confirmed cases here in our county. We've had a total of 8 patients in our facility. Right now, we have 1 patient. We have made a COVID unit, which we house them in. And we have been so fortunate, as Clay said, to look at evidence-based practice and know that we have KDHE and the collaborative right there. We watch them daily, sometimes multiple times a day, to see what is happening. What are they recommending? Sometimes we change, PPE recommendations every 2 days or every 3 days, but it's reassuring to know that it's evidence-based practice. We're doing the best thing we know right now. We say we have no visitors in our facility. We call them a support person. At first, we didn't have anybody coming, and we found, in these rural areas, we have a lot of elderly people. Sometimes there's some dementia involved. It's just the anxiety and the stress that they experience when they come into our hospital that sometimes they don't know the answers. And we found it was a safety issue. We needed a support person there for them. So we say we don't have visitors, but we allow 1 support person to come in full mask. We check their temperatures every day. We ask them if they have any symptoms. And then we do let them come in. Once they've come in, we ask them not to leave. And that has helped our community, knowing there's 1 person that can stay with that patient in the hospital. About the first week and a half or 2 weeks, we didn't allow anyone in. And that was very hard. And it's hard for healthcare workers because we don't communicate the way we used to. And that's difficult. We communicate in mass. You have go-to meetings. You don't physically see your peers. And we always know that communication is at the heart of every error that happens in the hospital. So we have really concentrated on safety at this time. And it is so good to have the KU Collaborative and KDHE. That is our source of information. And I get phone calls probably a couple times a week saying, hey, what are we supposed to do? And I just quote them. This is what KDHE says. This is what the collaborative at KU, this is what KU is doing. We are practicing the same medicine that they do at KU. That's very reassuring to our physicians also.
That is a great update, and I'm glad you brought up the thing about communication, because I always like every opportunity to tell people at home, you know, when this started and we all had to put masks on, I think that was the hardest thing when it came to communicating. Medical professionals maybe are more used to talking with a mask on and communicating, and you're close by so you can, you know, make sure that you're being well heard or well understood. But over virtual, like we're doing now, and having a mask, I used to tease, I can make people say anything I want them to, because you can't tell when you have that in front of your face. How is the mask culture? And here we've measured and we went to a lot of lengths to make sure that that we're safe even while we're talking in this moment without our masks. But we all, as Dr. Seitz shows, we all have our masks very close at hand. How is the masking culture in your communities, Austin and Beth? Let's start with Austin.
Okay, so within the facility and our employees definitely understand the importance of masks. It's still not mandated within Clay County. The commissioners and the mayor and Clay Center haven't mandated it, but most people are taking it very seriously and wearing masks in establishments when they go to the grocery store, the hardware store. So, you know, there's a few naysayers, but that's to be expected. But overall, people are taking it very seriously.
Mask
I think
culture?
I could say the very same. The majority of people, we don't have an issue when they come in. They don't like it, but you know, it's the new norm. And I think they've all accepted it. We as healthcare workers have to be the mentors, and people have to look at us to say, what are they doing? So when we go to the grocery store, we go out in town, we want to have a mask on because we want people to look at them and say, oh, that's what they're doing. That must be what we should do.
Exactly. My sister and I have talked about masks and hand sanitizer are going to be the new stocking stuffers at Christmas. I want to hear a success story or a couple of success stories from all of you real quickly, and then we're going to open it up for questions. So, Jody, I'll start with you. Give me a success story or two with a collaborative, COVID or non-COVID related.
Sure. We have a team of 11 healthcare coaches, and they work with Medicare patients who have multiple chronic conditions, and they have done some remarkable work really providing that additional support that folks have needed where perhaps a business is closed and someone's about to lose the roof over their head, finding them the support they needed to make sure that they could be safe and secure and not moving into a tent in the summer heat, which was literally one of those options. For other patients that had been, I'm high risk, but a member of my family has now tested positive. How do I quarantine? What sort of support did I need when all the clinics went to telehealth? How did I, as an elderly patient, understand how to connect in to my provider via telehealth, and how did we coordinate transportation when everything reopened? So a lot of really great success stories from our coaches around those one-on-one patient needs that are so very important when things are changing so rapidly.
Tell the story real quick that you were telling me before we began. It's not always necessarily like getting a prescription or being hospitalized. You were telling the story of someone who was about to lose their home.
Yes, absolutely. It's those very real life things that our health coaches deal with. An individual who has lost their ability to afford the place that they live and really needed an option. You know, someone in their 70s can't be living in a tent in the summer heat. I mean, those are just not things that can happen and should happen and were a consequence of the pandemic. And so the team really has done this amazing job of really managing all of the information that's coming in about how to help folks and how to coordinate and how to step up. And because they have a long-term relationship with these patients, they connect in with them month in and month out. They're the person that they could call and get reassurance and get good, solid guidance and really help them understand how to make the best of a tough situation.
Jody, have you got, Beth, I'm sorry, I don't know why you're Jody. Beth, Beth, have you got a story that comes to mind that you'd like to share?
Well, I have a couple of them. I was trying to decide which one was the most interesting, but one of them actually has happened recently, where we had a husband-wife team that one came in a couple hours earlier than the other did. And they're elderly. They try to care for each other, and they weren't caring. They were unable to actually care for each other, but that was their hope. That was their wish. So we put both of them in the COVID unit. They were right next to each other. They could converse. There was a few days that they were ill, very ill, and thank God for remdesivir. We hadn't had it until just a couple weeks ago, and now we have enough that we can use it, and we used it on both of those patients. But one of them was able to go home before the other one was, and they were each other's durable power of attorney. And I don't want anyone to identify these people. When you're in a small community, everyone can identify each other. So anyway, I will just say that one went home and said, I can bring the other one home and care for them. We said, oh, it's not a safe environment. You really shouldn't. They absolutely insisted. And we said, health-wise, she could probably go. She had recovered quite well, but you never know when these people are going to have a setback. So you really watch closely for when all of a sudden their SpO2 drops, their chest x-ray looks worse, they're having a more difficult time. And so we said, okay, we can't hold you here against your will. Went home. Within a day and a half, this patient was picked up again by our EMS. Brought them back. They really did not have medical reasons to stay at our facility. And I guess one of the things I thank the KU Collaborative for is helping us and helping nursing homes to say, yes, you can take these patients. And right now, nursing homes are very anxious, and I don't blame them. They have every right to be as protective as possible. But we could not get this person into a nursing home. So when this patient came back in, we took them in. Thank goodness for swing bed. We put them in a swing bed, and I think we're going to actually get them to a nursing home based on some of the information that we have received from the KU Collaborative.
That's awesome. Great story. Austin, you got a quick one before we go to questions?
Yeah, so this is just about the Care Collaborative and what's happened at Clay County Medical Center and a lot of the other facilities that we've contracted with the collaborative. But we really focused on cardiac, stroke, and sepsis patients. And just over the last, from 2017 to 2019, in the Care Collaborative alone for mortality rates with cardiac and stroke patients, we've moved that measure from 9.9% of patients passing away in our facilities to around 2.6 in 2019. And then on the sepsis side, just at Clay County Medical Center, just being able to detect sepsis a little sooner. In 2017, we're at a 12% mortality rate, and in 2019, we're at 0%. So again, we just think the best practice of the KU Collaborative helping our rural communities achieve those kind of rates.
That's awesome. It takes everybody for sure. All right, let's open it up for questions, and we start with media.
Yeah, Shane from KCTV5 wants to know, we know that younger people are spreading COVID-19 more and more right now. What are your thoughts on haunted houses opening up this Friday night? Do these have the potential to be super spreader events? And do they present difficulties with contact tracing?
Yeah, I think the answer to those questions are yes. We have to understand, when we're talking about haunted houses, we need to understand the clients or the customers who come, so it needs to be safe for them. Certainly if you can spread the line out as far as possible so that those parties or those groups of people that come together can be separated from other people. So that's the distance. Absolutely everybody needs to be wearing masks. in the haunted house itself and with the employees, everybody should be wearing masks. If you can wear a mask underneath the Halloween mask, that would be great. If you don't have Halloween masks but are using makeup, certainly everybody needs to have at least that cloth face mask on to help prevent the spread. Obviously, in the haunted houses, a lot of people are going to be yelling, so that can express a lot of virus into the air. Although the actual time of contact from a customer to an employee is going to be probably short, probably very transient. Again, you will have people yelling and screaming. That will express more virus into that immediate area. So certainly masking is going to be vitally important. Anything you can do to spread out the amount or the groups of people so that their distance from each other is better is going to help as well. And if you can continue to take those precautions, that will reduce the risk of spread of the disease. But it comes down to the individual clients and customers doing those things as well as the employees.
What about eye protection?
Eye protection, we've always endorsed eye protection. Certainly if you can wear face shields, whether you are the customer or the employee, that's going to be good. And again, any other eye protection you can buy from the hardware store, safety goggles, anything like that will help as well. It may be more advantageous for the employees, as the employees are going to be in that haunted house for that prolonged period of time. So,
all right. Do we have any media on the line that have questions? All right. Any other questions from media?
Nope, we got some from the public. So Angela wants to know, when is it safe to assume that you have not contracted COVID if you were masked in a home with someone who was symptomatic, not necessarily had it, but maybe had symptoms of it, but they were socially distanced?
Yeah. I think that's a good question. I think that goes back to the 14-day quarantine period that we talk about. It's at that 14 days, if you haven't had symptoms, then you are okay to come out of quarantine. You can certainly test, but testing does not get you out of quarantine. There is no good guidance for testing. Some people have posited that maybe testing at 5 to 7 days, but even if you're negative then, that doesn't mean you can negate the 14-day quarantine. We have had people here who developed symptoms at 12 days, so even if they would have tested at 5 or 7 days, we would have missed it. So that 14-day quarantine period is very important for that fact. We know the incubation period, for the most part, for people can be up to 14 days, and that's why it is so important, not necessarily to test, but to maintain that 14-day quarantine.
All right.
So on the topic of masking culture, Ashley said Johnson County is meeting today to debate the masking policies. What is the panel's thoughts on that in general?
All right, I'll start with you, Dr.
Yeah, I think the medical evidence is quite clear that masks as well as distance do help. We know that businesses around the nation and around our community have closed down. We want these businesses to thrive. We want people to be able to work. And the way to get back to doing that is by having the masking. We know that there is very good evidence for spread in small areas, indoor areas, and those would include restaurants and bars. We know that places that have closed down in-person dining are doing much better as far as spread of the disease compared to other cities or communities which have allowed in-person dining. So if we want to continue to be able to go to restaurants, to have our businesses open, the masking is vitally important to keep those places in business, to keep those employees working, and to keep food on their table.
Austin, you said that you don't have a mandate where you are, but people are still wearing the masks.
That's correct. Yeah, people are still wearing the masks. A lot of our community travels to Riley County, which is Manhattan, Kansas, and there's a mask mandate there for most public spaces. So I think that's why we continue to see people using masks even here where it's not mandated.
Beth, is it mandated in McPherson?
Actually, it is mandated that they are requesting, but how do you enforce that? Most every business that is open, most of our businesses have remained open just with reduced hours, have a sign on the door that please, wear a mask when you come in. Once in a while, you'll go into a store where someone isn't, but the workers always are, and the majority of people are wearing masks.
And I like to continue to go back to the Colorado experience. You know, one of their main industries is tourism. So you're looking at those ski areas. They have instituted a very good mask culture because they know that it's vital to their community and to their employers and their businesses. And so it has worked out very well for them. And again, the main thing about the masking is it does reduce your risk of getting COVID-19. So
yeah, I just got back from Breckenridge, and to your point, when you're walking into the community, they had signs posted that said you're entering a mandated mask area, and we got alerts on our phones one morning. Just kind of like you would an Amber Alert, and it was to remind us that we were in a mask mandated area. And that we needed to make sure we had our mask on. And they did have penalties and that kind of thing. But to your point, Beth, it really is probably hard to enforce it. But
yes,
common sense?
I think a lot of our members are in the same situation that Austin is, where it hasn't been mandated by local government, but people in the community look to their healthcare providers as leaders, their hospitals, their physicians, and those communities are stepping up and saying, just as you are, masks are really important, and people are heeding that call. Yeah. We are certainly not traveling as a Care Collaborative team right now, but as we talk with our members, we're hearing a lot of that sort of sentiment of people are looking to us and asking those questions, which is really good to see all across the state.
Yeah. And even if there's not an individual or a mandate throughout, you know, the individual businesses can certainly have that for their own business. And again, I think that's going to be the safest thing for their customers, for the community in general.
Yeah, that was a great question. Got another one?
Lisa asks, any thoughts on when people who are immunocompromised might resume some normal activities outside of the home? What type of benchmarks are you looking for?
Yeah. You know, that's a very good question as well. I don't know. We know that the virus is here. We know that there are cases every day, and the running 7 and 14-day totals can be different. Last week we had a decrease in the running 7-day. This week we've kind of had slight increase compared to where it was. It is certainly much better than where it was a month ago, but this virus for the time being is going to be here. And so you have to first understand that knowledge. And with the understanding of that, understand what you can do to reduce your risk individually as much as possible. And that is going out when you need to. If you do have to go outside or go to a business or go to a restaurant, make sure that that restaurant is outdoors and you can do outdoors. We know that indoors certainly is a risk factor for catching it. Obviously, masking, hopefully everybody wherever you're going is masking. Again, the mask provides a barrier to people who may be sick and may be expressing the virus into the environment, but also can offer some protection to you, the wearer, as well. So doing those types of things, again, face shields and eye protection are always endorsed as well. And just understanding that the virus is out there and being safe when you do it, understand your own individual risk.
All right.
Sean asked Dr. Hawkinson, what is the status of new treatments for COVID?
So currently, new treatments, so antivirals, remdesivir is an antiviral. That is the only one that is currently approved. There are other companies working on antivirals. Obviously, it would be nice if we could get just an oral antiviral, something like Tamiflu that we could get when we're diagnosed. As of yet, there isn't that on the market, but there are a lot of companies looking at those types of antivirals. In addition, the convalescent plasma is still being utilized in a kind of emergency use authorization. We will begin giving that here again. But again, we don't know exactly, how sick you can be, how much the benefit is if you're very sick. And of course, it's probably better early on in the disease state. And again, as far as vaccinations, we know that there are 20 or more vaccine studies going on and being looked at. So that is it right now. There are no other new treatments. There are other trials of things such as immunosuppressive type drugs, things that we tamp down or decrease the immune the immune dysregulation. Those drugs are already marketed for other types of illnesses and chronic conditions, but they are being trialed for COVID-19 as well, because a lot of the damage that is done in COVID-19 is, again, that immune dysregulation type of process after the initial viral infection. So there are those continuing trials that are going on, but as of yet, there's nothing new other than remdesivir, convalescent plasma, anticoagulation or the blood thinner, and of course the dexamethasone, the steroid.
I got to tell you how ignorant I am. What Beth just shocked me when she said, we just now got remdesivir. I mean, I would think that these drugs would be available to everybody everywhere.
Yeah, it's certainly getting better. The government originally took all of that and then distributed it to the states and had the states distribute it. Now it's all through I think a third-party distributor from Gilead, but now it's being it's rolled out to more communities.
Austin, do you have access to both?
We don't have access yet. I think they're basing it on allocation and caseload and positive cases within your county. So we're still waiting for our supply and haven't been able to order it through our GPO.
And Beth, I guess now that you've just gotten it and you told us a great story of how it was helpful and timely, it must be tough deciding what are the criteria for when you offer it now?
Dr. Stites could probably tell you more exactly what the criteria is. But if we are a small rural hospital, we don't have a pulmonologist on staff. We don't have an intensivist. We have great internal med hospitalists that do a great job handling these COVID patients. But we always ask ourselves, if this was our loved one, do we want to take care of them here in our ICU, or should we transfer them to a larger tertiary facility where they have things like the plasma, remdesivir? So before we had remdesivir, if there was anyone that needed intubation, we would intubate and ship. So if they needed remdesivir, they got it because we shipped them to another facility. But the last few weeks, we've been able to provide it here.
I think to be fair, the remdesivir in combination with, I think, the two more important components of this treatment algorithm and concoction is going to be that anticoagulation and the dexamethasone, the steroid. The remdesivir is definitely not a panacea. It's not a silver bullet. It is a pretty good drug, but it needs to be in combination with those other things as well, which I feel are probably more important. But as we move through this, hopefully we will get more potent antiviral medicines such as remdesivir.
Let's take a couple more.
So John has kind of a vaccine culture question. With the push from the government to get vaccines approved next month, how will the public in different parts of the state and here be confident that it is safe and effective before it's released?
Mm-hmm. Yeah, I think we have seen a lot of news recently about the government stepping in and giving their opinion to the scientists and the medical and the public health professionals. We know that the groups that are working on the vaccines, that are creating the vaccines, have signed a collaborative agreement to really work through the science, because that is going to be the most important thing. Working through the science, showing transparency, showing the data about safety and efficacy. And to be fair, we have certainly sped up the process of the vaccines. They do look safe. So far, everything we show does look safe. But we need to make sure that we complete these trials, or get as far into the trials as we can, to show further safety and efficacy. Luckily, all of these companies have signed that collaborative to do that, and they want to do it because it's in their best interest to do that. It is in their best interest to show safety and efficacy. So I think hopefully moving forward, there will be that information that is available to the public so they can see that it is safe. Because we do know that there is a anti-vaccination voice out there that is, fairly loud. And we don't want to do anything to harm our chances of giving vaccines in the future. So this is a huge step to make sure that it is transparent, that they do show all of their data for safety and for efficacy, because there are going to be the need for more vaccines other than this one. And we know that we continue to have our childhood vaccines, our adult vaccines as well, and everybody needs to get those to help prevent these easily preventable diseases.
Okay, so this viewer has a question about long haulers. Can the doctors discuss a little bit more about the idea that patients with COVID would experience long-term effects after they've been infected?
Yeah, so we certainly know, that has been the jargon associated with people who continue to have symptoms after having infection with SARS-CoV-2 or having COVID-19. That's the long haulers. We know that from studies that people can have symptoms for 30 days, 60 days, maybe even longer, especially if you had more critical illness and were in the ICU, you were intubated. Those symptoms can range, and a lot of this is going to be individual. I've seen patients who 3 months later still had a little bit of cough or had some fatigue. Those symptoms will range and be different from individual to individual. I think more common ones do include fatigue, cough, maybe shortness of breath. Those would seem to me the more common ones. The loss of taste or smell will come back gradually. It really does boil down to the individual. We don't know exactly how long that will last, but we do know it can last 2 to 3 months at least. Hopefully it will get better, but we just don't know how long. And we are developing a program or some verbiage here at the health system, especially with our outpatient primary care physicians, on how to best manage these people. There aren't treatments. A lot of this manage is going to be supportive care and symptomatic treatment for these things. And again, the most important thing is probably time.
All right. I think what we're going to do now is go to our guests and ask for some final thoughts and wrap up today's update. It's been a lot of great information. Austin, I'll start with you. Final thoughts?
We just really appreciate the Care Collaborative and everything the University of Kansas Health System has done for all of our rural hospitals in the state of Kansas, and I'm sure beyond, from just knowing what the proper PPE is to wear so we don't have to do all this research to which patients to put into which isolation rooms. So again, thank you to Dr. Hawkinson, Jill, and Jody for making this possible for all of our rural citizens in rural Kansas. It's a big deal, so thank you.
Deal too. We appreciate you as well. Beth?
I guess I'm just so appreciative that we joined the Care Collaborative in January. We had a boot camp that was well attended, and we worked on the very same things that is being worked on throughout Kansas, the chest pain, the MI, the sepsis, the stroke. And so we had established a relationship with the KU Collaborative. And it was so reassuring to know that, they're just a phone call away or an email away, and you get immediate response and you get best practice and evidence-based medicine. And just to know that you're practicing in that arena, that as a small rural facility in small cities, there's no reason that our farmers, our rural people shouldn't have access to the same health care that people in large cities have. And I think KU has certainly brought that to our facility.
Thank you so much, Beth. That was really kind, and it is the way it's supposed to be, I think. And Jody, I was going to give you an opportunity, and then we'll talk about tomorrow. What are your final thoughts?
I think I would echo what Austin and Beth said, is that we have this opportunity to share the great expertise of folks like Dr. Hawkinson and the entire team here. As we continue to go through this process, we're still learning more. There'll still be more information on vaccines and the long-term care for these patients, and we're still working with long-term care facilities on receiving patients. This is a long haul, and the more that we can be a resource, we really appreciate that, because our goal is to help improve the health of Kansans all over the state, and that's really the commitment that we're trying to live by through the Care Collaborative.
Well, Jody, you're doing God's work. Thank you for being on. Tomorrow, we are going to be back to answer your questions. I have every reason to believe that Dr. Stites will be back and sitting here, and with him will be Amanda Gartner. We're also have a last-minute ad, too. We're going to add Dr. Heather Harris from Hayes Med. She's going to join us and talk about COVID in and around Hayes, and we are going to start giving the patient numbers at that health system as well, or that part of the health system as well. So we know that it will be a good opportunity. We also want you to know that tomorrow is the last day to send us your list of 50 reasons to love your mask. You can send them to the same place as your mask-wearing pictures. We got this photo submitted by Elena. It was taken in 2018. She said her husband was battling cancer. She writes, he's a 3-time cancer survivor. We wore masks before it was even cool. Masking is automatic now to keep everyone safe, just like then. And Jennifer, she sent this picture in. She says she masks so that she can spend time with her grandson. And up in the Northland, Library Lauren sent us this picture. She said, I wear my mask to protect my friends, my loved ones, and my customers. So those are great. I don't have any wonderful words to wrap up the show like Dr. Stites might have. So what I want to say is thank you to the community and to the media that show up every day with questions. We will stay here and answer the questions as long as you have them. So thank you for being with us. Dr. Stites is back tomorrow with Dr. Hawkinson. In the meantime, have a great day.
Sure can. You can't. Can you hear me? No? Yeah, absolutely. All right, we're good. Absolutely. My name is Elizabeth Holshoe, ELIZABETH, and I'm the Director of Epidemiology at the Johnson County Department of Health and Environment. Yes, so our initial reach out to individuals who have been exposed to coronavirus is always via phone. It is never via text or email. One of our contact tracers will actually call the individual, identify themselves as a Johnson County Department of Health and Environment contact tracer or employee, and will let them know that they have been exposed to coronavirus. We will ask for some basic demographic information, date of birth, address, and those sorts of things. And that's really just so that we make sure that we know we have the exact individual, that we have them in the right jurisdiction. But we will never ask for any other, no social security numbers, no credit card numbers, none of those other, even deeper sort of personal items and information. Yeah, so we actually have a school team here at Johnson County Department of Health and Environment, and that's about 5 of our staff members within the Division of Epidemiology. And they are working very closely with each of our school districts, as well as all of our private parochial schools and our higher education schools as well. And we are really trying to empower and give our school nurses and school administrators the tools to be able to contact trace within the school boundaries. So if they have an individual who's become positive, they are really responsible for looking at who did that person come into contact with within that school. So school-related activities during the classroom time. And then Johnson County Department of Health and Environment really is the one who takes over any of those outside of school contacts. So if they went to a birthday party or if they went to church or something like that, that's really the purview of Johnson County Department of Health and Environment. Yeah, absolutely. So if you're feeling concerned that the individual that you're speaking to may be not being truthful with you about who they are or where they're from, you can absolutely call back to our main line and ask for the individual and they can connect you. So if you're ever concerned, absolutely ask to verify the individual's identity. They can also send you an email, which will have be from Johnson County government with their signature line, identifying them as a contact tracer. So there are a couple of different ways if any individuals, any residents are feeling concerned about it. Not a problem. Thank you. Have a wonderful day. Bye.
We're working on, that's what we're working on. Sorry for the delay, but we do have some extra communication items this morning, which we'll continue to work to mitigate.
What kind of technical problem are we having?
Pardon?
Can we start?
Can you hear it?
Echo.
There's no
Echo all over the place. And there is facilities set up outside where they can hear better.
Oh, you're right. It's gone.
So other than that,
Yeah. I had it up. I need to get a printed agenda. I mean, a packet.
Chairman, right now the on-base is not up, but Facebook is available. So Linda's checking logistics to see if we can proceed with just Facebook with our closed captioner, and she's doing one last check with technology. So we may be able to proceed just with Facebook if you're acceptable for that, but she's double checking that piece.
Okay, thank you.
Chairman, we are live on Facebook, and we are able to close caption it. We may still be having some overwhelming technical difficulties on the actual on-base website through our jocogov.org, but we are able to go live with Facebook and to proceed with the meeting.
Okay, all right. Well, thank you very much. And so at this time, we will call to order the Board of County Commissioners meeting for Thursday, September 17. Will the clerk please call the roll?
Commissioner Fast.
Aye.
Commissioner Allen.
Here.
Commissioner Klicka.
Here.
Commissioner Hanslick. Here. Commissioner Ashcraft.
Here.
Commissioner Brown.
Here.
And Chairman Eilert.
Here. All are present. We do have a quorum. Would you join with me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have a very, very full agenda today. We have a couple of items that we need to attend to before we move further into the agenda. And one of them is an excitingly pleasant recognition of one of our employees of Fire District Number 2 and his girl, Andrew and Brianna, for the heroic action that they took in rescuing family members when they were participating in activities along the Kansas River. So I'm going to introduce Fire Chief Jim Francis from District 2. He will make introductions of the Fire Chief from KCK, and then we will proceed from there. So Chief Francis.
Good morning, Chairman Eilert, members of the Commission. Thank you for having us here today. This is a very special day today. We want to make recognition of an event that had happened on August 22nd. So before we get started, I want to do some formal introductions. So today I have other chiefs from Fire District 2. I have Deputy Chief Colby Stansfield, Assistant Chief Andy Ravnikar. I have our 19-year veteran and firefighter paramedic employee Andrew Eccles. Andrew's girlfriend Brianna is here. And back over on the other side of the wall, I have Fire Chief Michael Callahan from the Kansas City, Kansas Fire Department. I have First Deputy Chief Jack Andrade, and I have Assistant Chief of Special Operations Scott Hawley. So in just a second, I'm going to turn the floor over to the Kansas City, Kansas chiefs to explain what occurred, but just to set the stage for you, firefighter paramedic Eccles and his girlfriend were on the Kansas River fishing out of his boat on August 22nd. He was off duty, and they were in the right place at the right time and made a pretty dramatic rescue. So I'd like to turn the floor over to Chief Hawley with Kansas City, Kansas, and he can tell the story.
Chief, okay, thank you.
Thank you, Chief. Chairman, Council, thanks for inviting us to be here today. On behalf of us, we want to appreciate the opportunity to be here and be a part of this great event. As it's already been, a little bit of the details have been talked about, just for those who are unaware of all of them. It was August 22nd, about 3:30 in the afternoon on a Saturday, that Andrew and his girlfriend Brianna were fishing on the Kansas River at what we call the Lowhead Dam right off of 435. At that time, there was also a family who were enjoying the afternoon on the sandbar on the south side of the river. A bunch of the children were playing, and a beach ball got hit out into the river. So at that point in time, an 11-year-old girl by the name of Rebecca went into the water to retrieve the beach ball. And for anyone who's unaware of the turbulence that can be created at a Lowhead Dam, there's a lot of undertow, a lot of turbulent water, and it's at that time that Rebecca was overcome by all of that turbulence and was taken underwater by the undertow and the current. When that happened, 2 other juveniles and an adult entered the water in an attempt to rescue Rebecca. All 3 of those persons were overcome by the waters also. Andrew and Brianna were fishing in that right exact area, saw what was going on. Andrew maneuvered his boat over to that location, and at that time, they quickly pulled both the other 2 children, the second and third child, to enter the water, and the adult out of the water. Rebecca was not able to be rescued at that time. One of the other juveniles, when pulled from the boat, was in full cardiac arrest. So Brianna started CPR on that young lady on the boat, and after several minutes of CPR, was able to get full spontaneous circulation back on her. Then Andrew also was able to shuttle patients from that side of the river to the north side of the river, where our department was able to access the water and then transport those 2 juveniles. It's without a doubt that had Andrew not been in that place at that time and had done the actions he did, that we probably would have had 4 deaths that day instead of just 1. His actions meet the highest standards and tradition that the fire service is all about. And as tragic as it was, Andrew should be looked at as a hero for the saving of the 3 lives that he did that day. Congratulations.
Thank you, Chief Hawley. At this time, I'd like to call Fire Medic Andrew Eccles and Brianna up here to the podium. Andrew, we'd like to present you with this Medal of Honor, Medal of Courage. It has the engraved letter from the Chief of Kansas City, Kansas, notifying us of this event with today's date and this recognition. So, Andrew, thank you very much. This is a job well done.
Amen.
It's awesome. Honor, we have the same thing for you. We have a Medal of Honor, the Civilian Life Saving Award. So, there you go. Thank you very much. This is great. All right.
Thank you.
Would you like to say
Thank you to Chief Francis for being here today, and Chief Ravnikar and Colby Stanchfield. Thank you to my family and my mom for being here today, and the whole entire board for having us. Really appreciate it. Chief's pretty much summed up everything that happened that day. We're just fortunate enough to be there. Wish we could have done more, but we saved a bigger tragedy from happening that day. Thank you for having us today.
Thank you.
Thank you very much.
Well, Andrew and Brianna, even though our ceremony is short this morning, please understand that you have the grateful community appreciating the courage that you demonstrated to do what you could to protect and save residents of our community. And Chief Callahan, thank you for being here today and making these presentations. And Andrew and Brianna, I really don't know whether there are words enough other than to say thank you for your willingness to intervene, your quick thinking, and the quick actions that you took to save several members of a family. So very, very important. Your district, your co-workers, and I know your chief is very, very proud of what you've accomplished. And I had an opportunity to meet the family members this morning, and I think they're also super, super proud of what the both of you have accomplished. Thank you so very much.
Thank you.
We'll take just a quick minute, short break here. We have one other recognition this morning, and I'm going to ask Deputy County Manager Maury Thompson to begin this presentation.
Thank you, Chairman and Commissioners, and thank you for this opportunity to recognize one of our county executives who will be leaving our employment this coming Friday. Mr. Tim Mulcahy, the Director of our Justice Information Management System, after 27 years of service to this organization and the citizens and the public safety community in Johnson County, is going to begin his well-deserved retirement. So I know we have a few words that we'd like to share with Tim this morning. So first I'm going to ask County Manager Penny Postock-Ferguson if she'd like to start.
Thanks, Maury. It's my pleasure to talk a few minutes about Tim, and he's not always the one that likes a lot of public attention, but sorry, 27 years you deserve this, Tim. But so 27 years ago, Jim started with just Tim and one other employee, and has had a 4-person governing board to create the Justice Information Management Systems, JIMS, which has grown to 28 employees, with 3 more to come in 2021. Under Mulcahy's tenure as director, JIMS has won several awards, including the Liberty Bell Award from the Johnson County Bar Association for its innovation in automating and providing electronic filing of documentation from arrest to incarceration. JIMS was first in the state to go paperless and the first to electronically file all records. In 2015, following a study conducted by the Justice Management Institute, Johnson County was showcased as one of 8 highly effective criminal justice systems in the United States. One major contributor to Johnson County's success has been the creation and continuous improvement of JIMS to make it one of the more robust integrated criminal justice record management systems in the country. And with that, I'll turn it back over to Maury. But Tim, you have really made your mark here. Obviously, by just the few highlights that I did here, but building a team that can continue on your work and the partnerships and collaborations that you've done with not only our other county departments, but our community partners, and being one of those that are looked at best practices from across the country. With that, thank you for your service. You will be missed.
Thank you, Penny. And next, our District Attorney, Steve Howe, is here this morning, and I believe he'd like to share a few words as well. Steve?
Thank you for an opportunity to talk about Tim. And I know Tim both as a friend and a colleague. And I will say that many of the commissioners have worked with the Criminal Justice, or CJAC, and a lot of the efforts and the abilities of CJAC to develop programs that are innovative, a lot of credit goes to Tim Mulcahy and the JIMS system. Because of our data collection ability, we're able to do a lot of data collection to help focus our plans and programs. And so we couldn't do a lot of the success, and we wouldn't receive a lot of the awards that we receive if we didn't have the ability of Tim's JIMS system to basically put that information together to drive processes. And so he should get a lot of credit for a lot of the innovative programs that Johnson County has been leading with over the last 25 plus years. So I thought we know about Tim and his JIMS, developing that system and being an innovator and a leader in the country, but a lot of people don't know some things about Tim, and Tim doesn't talk about this a lot, but he was one hell of an athlete. He was a great college athlete who then ended up being in the Baltimore Orioles farm system, and he has some great stories. And only because of injury were we lucky enough to get Tim probably with JIMS, because he hurt his arm, and therefore his career as a baseball player was ended. But let me tell you, I played softball with Tim after his injury, and I will tell you, I can't tell you how many times he would throw a ball and it would hurt. So I can't imagine how good Tim's arm was when he was a pro, because he just had a cannon of an arm. And I will say, knowing him both personally and professionally, Tim's the same person. He's a quiet professional. He's all about team. He's a good person in addition to a great leader. And I'm lucky enough to be able to call him a friend and a leader that I respect over all these years in Johnson County. So Tim, you're going to be sorely missed. I know our families know each other. My wife actually babysitted her kids, his kids, so we know each other quite well. And I wish you the very best in your retirement. You deserve some fun time, and I know you'll probably spend some of that time on the lake. So congratulations.
Tim, thank you very much.
Thank you, Steve. And before Chairman?
Yeah, go ahead. I thought there was a presentation that was going to be, okay.
There is. I'll get to that in just a second. I just want to touch on 3 things real quick and try not to repeat anything that Penny or Steve have shared, but I want to emphasize 3 points. You all are familiar with NICHE, our county-wide law enforcement records management system. No small feat to attain that. Former Sheriff Denning and I were having a conversation late one afternoon when that was about ready to go live, and said, this makes sense to be a county initiative. Quickly went to Tim and said, hey, need you to do this. A tremendous undertaking. And he said, yeah, I agree. It makes sense that it be landed here. He took that on and dedicated a couple of years to getting that up and going. Fantastic initiative. Steve and Penny both talked about the recognition that has been brought to Johnson County over the last few years, and I could go through the list from stepping up to our work with the National Association of Counties, the Council of State Governments, academic institutions who have repeatedly come knocking on our door to talk about what we're doing here and how it can be replicated. The foundation to all of that was our gym system that aggregated all of our public safety information into one place, making it shareable for the benefit of this community. So again, that was only possible through that foundation of the gym system. And finally, I wanted to talk on, we created gyms as the criminal justice data information management. That's been expanded over the last few years to a full-blown public safety IT department, now supporting MedAct and emergency management and communications, and just continues to grow. The reputation he's developed with our city partners is just outstanding. They look to gyms for guidance about how you structure those systems. So again, just wanted to emphasize those three things about Tim and his leadership. So I appreciate that. Okay. And finally, Tim, if you'd step up, we have a certificate of recognition to give you this morning.
Well, Tim, congratulations. Thank you very much. Would appreciate any comments you might want to share.
Sure. I wasn't really prepared to say too much today, but I appreciate all the kind words from Penny, Maury, and Steve, and yourself. Also, I'd like to recognize Joe Waters, who's been here from the very beginning. He's a friend of mine that I've known for a long time, and I appreciate him lending his ear whenever I had issues or problems and helping me out on that stuff. But really, we couldn't have done this, and when I say we, it's not Tim, it's we, without the support of the county commissioners. I know that I was first couple of years, I was an unknown, and then we had to prove ourselves, which is correct. That's what you should do. And then after that, we've gotten a lot of support from the commissioners, and we very much appreciate that. I'm not sure if you know that I've been through 5 chief judges, 5 county managers, Penny, 5 sheriffs, Calvin, and only 3 DAs. So I've outlasted quite a few of them. Not sure why they left, but I'm not saying it's because of me. But again, we couldn't have done it without the resources that we have in Johnson County, and also the great people we have in all the departments, as well as the gyms department. We have a lot of great hires in our department that are very innovative. A lot of stuff that we do, gyms didn't come up with it. It's people like the Risa Hannebergs, the Robert Sullivans. Those type of people are the ones that come with us with a problem and kind of a solution, and then we meet and we talk about an IT solution to those types of problems. And so it's been a great team effort with all the departments to come up with the system we have today. And I've been very blessed to be able to work at Johnson County for the last 27 years. So thank you.
Tim, thank you very much. For those of us who have been around a while, know that your family members have been involved in Johnson County for a long, long time. And appreciate very much the talent and the skill and the commitment that you've brought to Johnson County over the years, and in development of our justice information management system that is so very, very important in our criminal justice system. So thank you very, very much, Tim. We're going to miss you.
Right. Chairman, if I may, one of Tim's other primary customers is in the room with us now. So Sheriff Hayden, I don't know if you'd like to say any words as well.
We would all be in trouble if it wasn't for Tim Mulcahy. He made a state-of-the-art system that combined everything we needed in Johnson County. It was national awards. Everywhere we went to NACO, we went all over the country, and everyone couldn't imagine how many entities got together with this. Now the state of Kansas thinks they're smarter than we are. They got a new computer system, and I imagine, Tim, that when that fails, we'll go back to gyms. But we won't spend the millions of dollars they have. It is state-of-the-art. It consolidates all the information we need for everything. We've caught numerous criminals with it and done a lot of good. What people don't recognize from Tim is, you can tell he's a humble man, but customer service is everything with them. And I hope that's a tradition that will continue. We got good staff down there. They are programming geniuses. They've made anything that's thrown at them work. And that's incredible with the technology that we've got now. Every 6 months we got a new type of technology coming on, and they've stood with it. And we've got a system that's almost virtually impenetrable. It stands alone, and it's as secure as you can get. So, Tim, thank you for your service. I'm going to miss you, buddy. But the foundation and the system that you've built will stand for a long, long time. Thank you for helping us, and thank you for your service to our citizens.
Tim, again, thank you very much. Appreciate very much all the work that you've done for our county and those involved in our criminal justice system. Well, two special recognitions this morning, and we appreciate everyone's patience in that regard. We will now move to the public comment portion of our agenda. And let me emphasize that the public comment portion of our agenda, we receive comments on items that do not later appear on our agenda. I know there are a lot of folks who are here today who want to speak in regards to the masking issue. We will not take masking comments during the public comment period, but when we come to that item, after a brief presentation and questions by the commission, then we will open it up for comments on that subject. So, would the clerk please read the first speakers?
Chairman, I understand that we have over 60 speakers. Is that
No. We have. I'm told we have 5 speakers.
Oh, it changed. Okay.
For the public comment period.
Thank you.
So,
We have Brittany Vallis, and then we will have Emily Coleman.
okay. Please come to the podium, state your name and address, and limit your comments to 3 minutes. We have a large number of folks who want to speak today on various topics. Mr. Thompson will be keeping track of the time, but please, as a courtesy to everyone else who wants to speak, I would ask everyone to comply with that 3 minutes. Thank you.
Okay. Can you hear me okay? Right here? Okay.
Yes, speak clearly into the microphone.
Okay, right here? Okay.
Yes, that's better.
My name is Brittany Vallis. Do you want my full street address?
Yes, please.
Okay. Is that secure? Is that safe? Okay. 12340 South Hastings Street in Olathe, Kansas. It's a great address. It's very easy to remember. Thank you so much for everything you guys are doing today. Thank you for your hard work, for your consideration, and for listening to us come and speak to you on, our behalf as well. Basically, what I want to speak with you about today is just a reminder of who we are. And who we are human beings. Behind the masks, we are still human beings. And as such, we were born with a guarantee that someday we will meet our Maker. And during this life, it is guaranteed that sometimes we will get sick. And sometimes we might even be hospitalized, and it may not be fun. Any virus that is out there, we cannot control it. We cannot control other people because we were given that free will the moment we were born, the moment we were created. And what is happening right now with these mandates, with these rules and these restrictions, by requiring other people to take action in order to protect someone else with that motive in mind, and with masks and everything else, it is creating a division. It's creating a lot of fear over something people cannot control. You cannot control a virus regardless of how hard you try. And when fear happens, it leads to anger, and anger leads to hatred. A little friend called Yoda said that once, and I love it. As a business owner, I'm experiencing that hatred almost on a way too regular of a basis. Just 2 weeks ago, a 60-year-old man came up to my face 2 inches away with an anger where he wanted to hit me. And I have never experienced that from any man before, much less a 60-year-old man. I'm a tiny woman. That's the kind of anger that is happening. And the longer these mandates happen, the longer you guys continue extending this, that's what your county is going to be composed of: division and hatred and anger. And I know that's not what you want, because you guys are good people. And I know that you love people, and you're doing what's best for us. So please allow us the freedom to be human beings. Allow us the choice to establish our own risk and go out into this world how we feel is best, and allow love to take place instead of anger and hatred. Thank you for your time.
Thank you. Well, again, let me emphasize, this public comment period should not be addressed to the mask issue. Speakers will speak to that issue when we come to it on the agenda. So during this public comment period, I would ask that you speak to other items that are not on our agenda. Thank you.
We have Emily Coleman. Then we will have Susie Reach.
Hi, my name is Emily Coleman, and I live in Spring Hill, Kansas. And I've spoken before you guys numerous times to outline the many deceptions that our public policies of the public leaders have issued, regarding public policies. The mask, or not the mask, sorry, the chart where Dr. Norman, used 2 axes to show how, one thing was working in some counties that had mask mandates and some that were working in counties that didn't. That's just an example. But recently, Governor Kelly, issued a press conference where she actually exaggerated a deceptive claim about COVID deaths in September. She said there were 23 new deaths reported between Friday and today. This is a quote. It is understandable that most people would interpret Kelly's statement, as did Halver's Capitol report, which wrote, she said there were 23 COVID-19 deaths in the state over the weekend, bringing the total to 534. But this is not the case. These deaths did not occur over the weekend. They were just reported over the weekend. So these semantics, these words, are just put out there to confuse people. And when people actually look into the data, no one died over the weekend. No one died on Saturday anyways. One died on Sunday. But when they looked at the data, they found that most of the deaths that were reported in September have actually occurred in prior months. We have complained over and over again about the lack of good data that is making these dictates. Recently she also, issued her hotspots targeting businesses that don't have current outbreaks. This is unacceptable. And you need to make your decrees, they need to be based on sound science. And we're not dumb. We know how to get onto the internet and verify the claims that are being made. And time again, the claims that we're being told are not true, or they've been manipulated in a manner that implies that you think we're stupid. We're not stupid. Thank you.
Thank you.
Chairman, our on-base feed is back up live.
Okay.
Just want to make that remark. Now we have Susie Reach. Then we will have Rebecca Shipley. And if you could please announce your name and your address when you come to the podium, I'd appreciate it.
County Commissioners, good morning. My name is Susie Roach. I'm a resident of Olathe. I introduced myself, but who am I? To you, I am no one. I will not bore you with my medical history that puts me in the governor's mask exemption category. Instead, I will focus on 2 particular groups who are negatively impacted by the mask mandates: survivors and our youth. I do not expect you to care what happened to me. My wrists pinned over my head with one hand while he used the other to cover my mouth. I do not expect you to care about the absolute panic I feel when my mouth is covered. 1 in 4 women experience sexual assault. 25% of women share this past trauma. The flashback mask's trigger forces the victim to relive it. The terror the mask provokes, feeling silenced, choked. 2 decades in a pandemic later, I speak of this for the first time openly. In this moment, I am the voice for the survivors all around us, not yet able to discuss it. Could be the person next to you or a loved one. Would you care then? 1 in 4. Next, I do expect you to care about our youth. They matter. Our generation that will one day fill the seats you currently occupy, their decisions will impact you someday when you are elderly. Beware of the psychological aftermath that your decisions impart on their young minds during their most formative years. When you're 50 years old, 1 year accounts for 1/50th of your life. That's just a sliver. My son, however, was 3 when COVID began. He's now 4. A year is a quarter of his life. That is significant. These kids no longer see smiles in stores. They're being deprived of learning facial cues for ever important social skills. Instead of being out in public shopping, stimulating the fragile economy, we stay home so that my children won't have to see a faceless, masked up world. Unless you want a generation of sociopaths unable to read human emotion, then it's time to let these children see smiles again. My daughter was enrolled in private school for kindergarten. She's a brilliant 5-year-old reading at a 3rd grade level. She has a lust for learning. Unfortunately, I had to unenroll her before the school year even began. Because I fear the Rona? Absolutely not. Rather, I did not want her love of learning to be squashed. If she were being scolded all day, every day, for pulling down her mask to breathe, for hugging her friends, for singing indoors, God forbid, then learning would no longer be fun. This is not normal. I refuse to let this be our new normal. So in conclusion, who am I? Perhaps to you I am nothing, but I am everything to my kids. Our mouths will not be covered. We will not be silenced. End this mask insanity today. Vote down the mandate. The collateral damage is too great.
I'm going to have to ask you to conclude.
Thank you, and God bless.
Thank you.
Rebecca Shipley. Rebecca Shipley.
Hello, Rebecca Shipley, 21,000 West 105th Street. You guys are going to have my address memorized by next week. I was going to talk about budgetary and taxation and the hardships of owning a business right now in Johnson County, but then Tuesday happened. And I've told you I don't agree with Mike Brown all the time, but he had it absolutely correct. He echoed what is happening in this nation. Make no mistake, war is here. It's happening in many towns across this nation. And if you think it can't happen in Johnson County, you're naive. Some officers were shot point blank while sitting in their car. Then they were blocked from getting to the hospital. And then they were chanted upon to die in this nation. Mike Brown's sentiment is not alone. About 3 months ago, I looked into a concealed carry class for myself, and it was booked for 3 months. That class happens for me this Saturday. Doesn't happen because Mike Brown told me to get prepared. My gut did. This is happening. Call and see if you can buy ammo. It goes quickly. It's happening. I'm not alone. We are in a position where we can't even recruit officers in our region here. Would you want your children to sign up to be an officer right now? It's worse than thinking of them going to the Army, into a position that's hated even more than your positions. I pray for our officers every day, but I know there's a possibility that when I call 911 in the future, that no one is coming. And I promise you, I will be there. I will pick a V. You know, my parents stood me in front of a mirror often because we owned a glass shop, ironically, and they showed me who was going to take care of me the rest of my life. That's me. I count on me. And my mom said, you're going to have to learn your life to pick a V. You can be the victor or you can be the victim. And it's me that's going to be taking care of my family, my property, and myself. And if you don't see that what Mike Brown was saying is a sentiment of this part of town, then you're naive. He wasn't calling people to take arms and go to war. He was calling on people to be prepared to defend themselves. It's scary, guys. I piggyback on what Brittany says. There is a lot of anger, and anger leads to fear, and fear leads to war. You guys are in a position to make some decisive decisions today. We should all be accountable for ourselves and be able to protect ourselves. If you want to wear a mask, great. If you don't, I get it. We have the right to breathe, too. We are sovereign.
Good.
Ed, I'm going to ask one favor before I wrap this up. I'm going to ask that before you guys make this vote, that you don't tell Jim Allen how to vote. He is very capable of making those decisions on his own. Thank you.
Okay.
I resent that comment.
I'm sure that you resent lots of things I say, sir, but I say it with respect.
All right. Thank you very much.
Tara Sharp.
Okay.
Tara Sharp.
Tara Sharp, 6614 Charles Street in Shawnee. So the reason that I'm speaking in the general comment portion rather than the mask portion is just how can you shut us down based on misleading data and then raise our taxes? I mean, we are putting people out of business, out of work, and then asking them for more money. That is not okay with me. Not okay. And regardless of how bad any virus ever actually is, and I'm talking about in reality here, not pretend data, not data that's been manipulated to look scary, not data that we've sifted through and found what we want to share and then we've purposely left out what we don't. I'm talking about reality. We should never give up our freedom, and you should never vote to take it away from us. My son is learning all alone on an iPad in his room. I have a stubborn co-parent, so that's part of the problem, but it is mainly because the school board made a decision which went against 70% of students, teachers, and parents. I don't know who they're trying to appease or impress, but it's not the right people. And it has me seriously questioning their motives, and I know they take their cues from you and other government organizations. And I will move on to the mask question, and maybe they work, and we should absolutely be allowed to wear them if they want to. I spent almost a full day looking at actual research studies to show whether the masks help or whether they're harmful, and the research is equally inconclusive and sparse on both sides. Regardless of how bad any virus ever actually is, again, we should never give up our freedom. And I want you as commissioners to know that my house is on the market in large part because of your poor decisions. And there are more property owners that will follow suit if you don't straighten up. Thank you.
Okay, thank you. Was there someone else?
No, sir, that no one else signed up to
All right,
speak at
that
this time.
concludes the public comment portion of our agenda. We will move to the balance of the agenda. There are no notes for the record today. And we will move to the consent agenda items. Will the clerk please read the consent agenda items?
Item number 1, consider approving the August 27th, 2020 business session minutes. Item number 2, consider the reappointment of Paula Hurt, Chairman, Representative to the Commission on Aging through August 31st, 2023. Item number 3, consider appointing Robert R. Cantu, 5th District Representative, to the Commission on Aging through August 31st, 2023. Item number 4, consider reappointing Michael A. Panthethier, P.E., Electrical Engineer Representative, and James Mike Vaughn, Mechanical Engineer Representative, to the Board of Code Review through May 31st, 2023. Item number 5, consider appointing Adironki Kiki Adarjunde, 5th District Representative, to the Developmental Supports Board through August 31st, 2023. Item number 6, consider appointing Chad Riley, 4th District Representative, to the Housing and Community Development Advisory Committee through March 31st, 2021. Item number 7, consider reappointing Heidi Thummel, 2nd District Representative, to the Transportation Council through August 31st, 2023. Item number 8, consider reappointing Andrew Belt, 6th District Representative, to the Board of Zoning Appeals through May 5th, 2023. Item number 9, consider reappointing Rebecca Galati, 1st District Representative, and Nancy Wallerstein, 2nd District Representative, to the Museum Advisory Council through May 7th, 2023. Item number 10, consider reappointing James Donovan and Richard Bashir to the Consolidated Fire District Number 2 through August 25th, 2023. Item number 11, consider approving and ratifying an addendum to the property conveyance agreement between the Board of Directors of the Johnson County Library, JCL, and the City of Marion. Item number 12, consider authorizing the Mental Health Center to add 1 FTE and authorize the reclassification of reserves in the amount of $98,000 in the FY 2021 budget for a proposed co-responder position to provide crisis intervention assistance to the City of Overland Park Police Department. And item number 13, resolution number 067-20. Approve and adopt resolution number 067-20, approving and authorizing the execution of a partial release of facility related to the release of a portion of land and improvements from the amended and partially restated base lease as amended, and the amended and the partially restated lease agreement as amended, together the master lease agreement, between Johnson County, Kansas and the Public Building Commission of Johnson County, Kansas.
Okay, thank you. Is there any item a commissioner would like to have considered separately? Is there anybody present who would like to have an item considered separately? If not, it's back before the commission. A motion is in order. Mr. Allen.
Move for approval of the consent agenda as presented.
Motion's made and seconded to approve the consent agenda as presented. Will the clerk please call the roll?
Commissioner Fast.
Aye.
Commissioner Allen.
Aye.
Commissioner Klicka.
Aye.
Commissioner Hanslick.
Aye.
Commissioner Ashcraft.
Yes.
Commissioner Brown.
Aye.
And Chairman Eilert.
Aye. Motion carried. Next item, moving to the action agenda.
Item number 14, application number NW 20-41-PP-LE and plat exception authorization numbers 9-17-20 A, B, and C. Consider request from Brett and Kimmery Manifold applicant and landowners for a revised preliminary plat to be known as Brenland Ridge for the 4 residential lots on 76 acres zoned RUR rural located at 30600 West 143rd Street.
Mr. Penley.
Good morning, Chairman, Commissioners. Sean Pendley, Planning Department. I'll be presenting this case for Diane Wickland. Subject property is located on the north side of 143rd Street and west of Gardner Road. You may recall this application was before you on July 16th, and the board voted to remand this back to the Northwest Consolidated Zoning Board for further consideration of a revised preliminary plat. Here's an aerial view of the subject property. Again, north of 143rd Street, includes 2 parcels. This shows the aerial of that property and also a graphic of the preliminary plat, just showing the surrounding area, existing residential properties to the north and larger residential properties to the west and south along 143rd Street. This is a revised preliminary plat. The revisions that were made since the last time this was before you and when this was presented to the Northwest Consolidated Zoning Board basically entails the reduction of 1 lot. The revised plat shows lots 1 and 4 that are accessing 143rd Street. Previously in this area that's on the east side of the property was 3 lots. The applicant has revised that to 2 lots. So they're now sharing access from an existing private driveway to 143rd Street. As proposed, this private driveway will have a 40-foot wide access easement. Lots 2 and 3 on the west side of the property will have access from an extension of an existing street stub to the north, Lakeview Drive. That will be provided with a cul-de-sac street for extension of that to serve those 2 lots. Nothing has changed essentially with access on that part of the property. The revised application does include 3 plat exceptions and 1 waiver from the minimum infrastructure requirements. Plat exception 1 is to allow lots 1 and 4 with a 20-foot wide street frontage instead of the required minimum 35 feet per the subdivision regulations. The plat exception 2 is to allow lot 1 to have a lot depth to width ratio of 22.5 to 1 instead of the maximum required 4 to 1, and to allow lot 4 to have a lot depth and width ratio of 35 to 1. That's the flag-shaped lot. And then finally, the plat exception 3 is to allow a street extension of 100 feet via the cul-de-sac from Lakeview Drive. That existing street is 2,800 feet. With this extension, that would create a 2,900-foot street. The maximum street length is 2,000 feet, but it should be noted that that existing street is already 2,800 feet, so this extension is only extending at 100 feet. Finally, there's 1 waiver for a lot, the lots 1 and 4 that each have 20 feet of street frontage, where the required is 330 feet of street frontage per the Carnot Plan and subdivision regulations. There were neighbors that spoke on this application at the zoning board meeting and at the previous BOCC meeting in July. The written comments from the neighbors are included in your packet for the materials for this application. Planning staff recommended denial of the revised preliminary plat and due to the plat exceptions and for the reasons that were noted in the staff report. Upon the remand in the second hearing before the zoning board, the board recommended approval of the revised preliminary plat showing 4 lots with the 3 exceptions and 1 waiver, primarily because of the reduction of lots on the east side of the property and the fact that that reduction addresses the fire code issues for safety and access for those lots. There were previously questions from the commissioners regarding the shared access for the driveway. Those property owners for lots 1 and 4 will be required to have shared maintenance and responsibility for the cost of that drive, and a maintenance agreement will be required for that driveway. If this application is approved, the final plat will include an access easement for the shared driveway. Since this application was remanded back to the board and is returning for a second time, the board has the following action items or action options: to 1, approve the application as recommended by the zoning board; 2, to deny the application as recommended by planning staff; or 3, to defer the action for further consideration. This concludes staff's presentation. I'd be happy to answer any questions. Also, the applicant is available for comment and presentation as well.
All right, thank you very much. As I understand, this is could be described as a difficult piece of property. So the zoning board did review the concerns of the planning commission. Is that correct?
That is correct.
And were there adjustments made in an effort to address those concerns?
That is correct. The primary change was being the reduction of one lot, and that did address the fire safety code issues for access on 143rd.
Okay. Mr. Chairman. And the staff is still, your position has
recommended
not
denial
changed?
just due to the fact that it doesn't comply with the zoning regulations and subdivision requirements for frontage. But we understand the zoning board made a recommendation for approval with the exceptions, and those reasons, they noted those reasons, and those are included in the packet. So we are not going to oppose the board's recommendations for this.
Thank you. Mr. Klicka?
Mr. Chairman, I had a chance to talk with planning staff over this issue, and I know it was a real tough one for the staff because on one hand they were trying to abide by the normal the planning guidelines, but this property and from what I've been able to pick up, and I'm sure Commissioner Brown can either echo this or counter it, this is a very, very unique piece of property, and it appears that along with the zoning board that all the parties have come to an agreement on this, and this would probably be one of the times I'm saying, you know, this has got to be an exception to the rule. So, thank you.
Other questions? Mr. Brown? Excuse me, Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Penley, formality, I just wanted to wish you a happy birthday.
Thank you.
So what would it take for staff to change their position and support this? I mean, what would you have to do to a property of this nature?
It's a very difficult situation, as pointed out, just I think due to the topography and the existing access. Really, the only way staff would be able to outright recommend approval with exceptions would be to just have one lot fronting 143rd Street. But we understand that the topography, that would essentially eliminate half of a whole developed area of this property because there is a power line bisecting the site, there's a large ravine through the middle, so it would be very difficult to only have one lot on that side. So, but to meet the subdivision regulations, the only way staff would be able to recommend approval would be just to have the one lot. But we understand why the applicant has designed it this way, and they did make an effort to address the zoning board's considerations for reducing the lots and to address the fire safety issues with access. So that's why we're not opposed to those exceptions.
Boy, Sean, you punted that one real well.
Thank you. Thank you. Are there other
Point out
questions?
the regulations.
All right. Is the applicant present? Any comments they would like to make?
Todd Allenbrand, Payne and Brockway, 426 South Kansas Avenue. I would just like to say that we are pleased at the zoning board. We were able to come together and work with the zoning board. And I understand staff in the county's position about setting a precedence, but I think in a case like this, it was a very unique piece of property, and I honestly feel there's probably some other properties out in the county that could be viable developments that have situations, maybe not a full-blown subdivision with multiple lots, but at least some opportunities for some shared driveways and constructing some additional houses, which, you know, always helps the tax base a little bit. But, you know, we're just really pleased, and I know that the owner is really looking forward to moving on to the next step of getting it platted and proceeding with the construction of a house. So
okay,
we appreciate it.
Questions of the applicant? All right, thank you very much. I know there were speakers at the zoning board. Is there anyone present this morning who would like to speak to this item?
I have had no one sign up.
All right. If not, it's back before the commission. A motion is in order. Mr. Brown.
Chairman, I'd like to make a comment first, and then I'll be happy to make the motion to a couple of questions that were asked about the difficulty and challenges of this particular piece of dirt. This is a textbook example of a one-off, which brought to you by the Big Six, continues, but this is challenging at an incredible level. The willingness of the landowner and the applicant and staff to get to this point is remarkable. It is remarkable. This is an an incredibly difficult piece as a builder developer myself, trying to get to figure out how to make this work. Very, very challenging. So I commend them for sticking with it. And this has been a long road. It's been a very long road. But I am happy to make the motion if you're ready, Chairman.
Right ahead, yes.
I move to approve a revised preliminary plat for 4 residential lots to be known as Brenlin Ridge for the reasons and subject to the stipulations recommended by the zoning board, plus a waiver from minimum infrastructure requirement regarding minimum street frontage. And I further move to approve plat exception authorization numbers 9-17-20, A, B, and C for the reasons recommended by the zoning board.
Second, Mr. Chairman.
Motion has been made and seconded to approve the application as recommended by the zoning board. Any further questions or comments?
Mr. Chairman.
Mr. Klicka?
I don't know how you feel about this, Commissioner Brown, but I need to take a moment here to credit Sean and Jay and that team. Over this past year, I've had the amount of complaints that I've had in my district relative to zoning and planning department have been non-existent compared to what they were over the past few years. I don't know what you're doing, Jay, Sean, but people, even when you have to give them bad news or you can't agree with them, I don't hear complaints about that. They're understanding, you're working with them. And to me, you folks are doing something that it's contagious, because I'm seeing that with the folks that I'm dealing with. And I don't know, Commissioner Brown, are you sensing the same thing?
You took the words out of my mouth.
So please, thank you, gentlemen, and I appreciate your help to the citizens in District 3 and 6.
Okay, the motion is before us. Are there any other comments?
One quick one,
Mr.
Chairman.
Brown.
Thank you. This in no way, making this motion, is a rebuke of our staff in the work that they put in. I hope that they heard me say I commend all of our staff. So that is not what this is about. And you are right, Commissioner Klicka. When I first came in as a commissioner, no tended to be was the lead answer, and then we had to fight our way to figure out if there was yes. That paradigm has shifted under the leadership of Mr. Leipzig, and it is all made all the difference. That we go look for yes, not for no, in our books and our codes and our restrictions. And I'm very, very happy with how this has transitioned and moved forward. And I'm ready to vote when you are.
Do we credit the county manager for good find?
Absolutely.
Okay.
All right. Okay. Thank you very much. If there's no further comments, the motion is before us to approve. Will the clerk please call the roll?
Commissioner Fast.
Aye.
Commissioner Allen.
Aye.
Commissioner Klicka.
Aye.
Commissioner Hanslick.
Aye.
Commissioner Ashcraft.
Yes.
Commissioner Brown.
Aye.
And Chairman Eilert.
Aye. Motion carried. Next item.
Item number 15, consider whether to reaffirm Governor Kelly's Executive Order number 20-52 issued July 2nd, 2020, extended to October 15th, 2020, requiring masks or other face coverings in public in Johnson County, Kansas.
Cindy Dunham, Legal Department.
Thank you, Cindy.
For your consideration is Governor Kelly's Executive Order 2052, which was issued on July 2nd, requiring masks or other face coverings. It was extended to October 15th by the State Finance Council's extension of the State of Disaster Emergency Proclamation to October 15th. Those two dates coincide. You have 3 alternatives before you this morning. First is to take no action, which would allow the executive order to remain applicable to Johnson County. The second is to reaffirm the executive order, and the third would be to take action that's less stringent than Executive Order 52. And under House Bill 2016, to be less stringent, there are 3 specific statutory findings that must be made by the board and placed in an order by the board.
Okay, questions of Ms. Dunn? All right, thank you. Dr. Ariola and Dr. LeMasters, any recommendations that you would have in regard to this item?
Morning, Commissioners. I don't know if you can hear me with the mask on. Is it okay?
Doctor, can I ask you to remove your mask while you're speaking? We do have hearing issues on the dais, and
Thank you.
It's difficult. Thank you.
I appreciate that. I do as well, thank you. Good morning, Commissioners. Very happy to address you and see you again after a little bit. We wanted to just quickly review some thoughts. Just wanted to make a couple of thoughts for you. Our colleague Elizabeth Holshoe will be presenting the county report on COVID a little bit later. As you are probably aware, we have over 9,700 cases so far, 90 to 100 per 100 cases, 90 to 100 cases per day, and our current 14-day percent positive rate among our testing is 12.4%. We've been working with schools diligently to try and keep them open in a safe manner, and as we are happy to say, we've seen a steady decline in hospitalized patients and currently maintaining good availability of hospital beds and ventilators, as we've discussed before. As we have said on numerous occasions, the science clearly indicates the effectiveness of wearing masks to reduce transmission. Asymptomatic spread may be responsible for up to 50% of transmission of this virus. There are a number of studies that have been published and support this. Among household cases, wearing masks during isolation decreases transmission of uninfected people in the household by up to 79%. In a large review of over 170 studies, wearing masks decreased transmission by up to 85% relative to those not wearing masks. And social distancing, maintaining more than 6 feet of distance and eye protection did even more. We've heard questions come recently whether areas that have mask mandates have better decreases in transmission compared to those that do not. It's very difficult to make this comparison because generally those areas that have the mandates have had a higher number of cases and rate per 100,000 than those without, or that have not instituted the mandates or not supported them, often have a denser population, a higher number of people living in poverty, and those who have multiple diseases that put them at higher risks. There is no reliable information that I'm aware of to date, that may be out there, but I'm not aware of it, that can reliably tell us about mask compliance with the mandates. We have, however, recently looked at several other metro areas, and as a sort of comparison, Des Moines, who has percent positivity rates very similar to ours, instituted a mask mandate on 8/26. They also have seen a recent increase in cases, a wave similar to ours, and to my awareness, no recent discussion there or serious attempt to revoke their mandate. Arkansas has a state mandate that started in late August and was also associated with restrictions on dine-in in restaurants, and they have seen their percent positivity go down from 10% to about 5%. Our recommendations, therefore, are that the County Board of Commissioners continue to affirm the governor's executive order mandating mask use in public areas. We also recommend expanding PCR testing of organizations in which there is contact between frontline workers and the public to identify where asymptomatic spread is taking place and work together to interrupt that. I'm very thankful for the work of the Board of Commissioners, that we are collaborating together on this, and your support for the Public Health Department. We are thankful that you are in the position of making this policy decision.
Okay, thank you. Dr. Ariola, any comments you would like to make?
Good morning, Commissioners. Just to add to what Dr. Lumasa just said, is that mask is by far, and this is reaffirming what the Centers for Disease Control and Prevention Director said yesterday, and what Dr. Deborah Back said to us via phone call last week, is by far the most important, most effective public health tool that's available to us right now. And so, again, our recommendation is to reinforce and reaffirm the mask mandate. Thank you.
Okay, all right, thank you. Any questions? Mr. Ashcraft.
Thank you, Mr. Chairman. Dr. Lemasters, I'll direct this to you, but if you so choose to pivot, please feel free.
Thanks.
You're familiar with the R value when it comes?
Yes.
Okay. Can you give us a perspective in terms of the R value now in Johnson County and how it relates to, Dr. Arreola talked about shooting for, I believe, a 5% cutoff, that may not be the right term, but demarcation for getting your or his recommendation to remove the mask.
Right.
Is there a relationship? How does that work? How are we tracking that?
Right. So I am not aware that we are calculating on an ongoing basis the R value for Johnson County. That could be done. There is a way to do it. It is not. It is the current effective. What it means is the current effective transmission for how many people an infected case infects in turn.
Arguably, it's related to trending, but I'm just wondering if we use that.
We are not currently, to my knowledge, calculating that figure. We have been calculating the percent positivity and following that. There is a relationship between the R value and obviously transmission. The things that contribute to the R value, obviously the infectiousness of the agent, which we can't do anything about, but then also the number of contacts between people that are infected and not infected, and how long that contact happens. Those are the things that we can do something about, and what the mask mandates, or as far as that goes, mask wearing attempts to interrupt. If there's interest in us starting to calculate and monitor changes in the effective R value, certainly we can do that. It's just not one of the things we've been currently tracking.
Okay. Well, along those lines then, how do we track the asymptomatic spread in Johnson County? I think intuitively we know it's there, but to what extent has it permeated the population? How do we gauge that? And when I say we, the average non-medical, non-PhD reviewer and arguably decision impactor.
I'll let Dr. Arreola come in on this too, but a couple of comments here. One is that, of course, the percent positivity is the number of cases divided by the number of people that we test. And so our aim is to be able to test more people that are not having symptoms, to be able to determine whether those people, whether there are asymptomatic cases out there. We have opened up the availability of testing through the county so that you don't just have to come to have symptoms to be tested. And I'll let Dr. Arreola talk about our plans for additionally expanding testing in the population that are asymptomatic.
Okay. And as a follow-on, and Dr. Arreola may want to address, if someone has had the disease weeks or months ago, how do we capture that? Because what I understand from the current literature is that there is some residual immunity in the population. We don't know how long it's going to last, but it does seem to have a positive impact on reinfection, at least the literature I've seen.
Yeah, I can address that particular thing. This has to do partly with the antibody response to infection. So one of the problems that we have is that the antibody response to infections starts about 14 days after the person becomes infected and peaks out at about 3 weeks. Thereafter, it declines, and there is concern that if you did antibody testing a long time after somebody had been infected, you might not find that antibody test to be positive. However, the current belief is that, like a number of other viruses, hepatitis B being a good example, after immunization or after an after infection, that there is a cell-mediated immunity through the T cells that would and other plasma cells that would, if they were re-exposed to the virus again, that would come back up and protect them. But we don't yet have any way of being able to test for that. The antibody test is all we have. It's most effective after symptoms or after the actual infection has happened, about the first month. So if we were to do large surveys right now of the population who are asymptomatic, trying to determine whether, using the antibody test, trying to determine whether or not what proportion of them had been infected in the past, we probably would vastly underestimate that, because that humoral immunity, the antibodies have waned after a month.
And those antibody testing, is that restricted to T cells, or are B cells also tested?
No, the antibodies are produced by B cells in the blood, and they're circulating factors. They are cleared out of the body when they stop being produced. The B cells would still be there, but the antibodies are just things that are cleared by your body, like anything else, after a certain period of time. The products of the B cells.
Thank you.
Okay.
Any other questions?
I don't know if you want Dr. Ariola to speak a little bit about our testing process.
If you could.
Doctor?
Our testing program has been pretty broad since April, really broader than most other municipalities were doing. We were testing, we were not restricting our testing to just people with symptoms, and that continues to be the case. And also to make a distinction between asymptomatics and pre-symptomatics, which is one of the key reasons why masks are very important. Just this week alone, we have had to deal with workplace, just to define that broadly, of people that were carrying the virus, but they weren't showing any symptoms, but the test showed that they were carrying the virus. And that allowed us to quickly put in public health interventions in place. So we see that quite often. A rough count of asymptomatic, of the percentage of asymptomatic, that was about slightly over 10% that tested positive out of our test the last time that we did that. But we are entering all those data so we can have a closer estimate of what percentage of our cases are asymptomatic. But we pick those up, and those become really the biggest concern that you have. People that are positive tend to know that they are positive, and they take steps to prevent spreading. But people that don't know are part of the reasons why mask is especially very important.
Okay, all right.
One follow-up, Mr. Chairman. Dr. Ariola, then, have we had any success in developing what I think is commonly called the CSI, the COVID Severity Index for Johnson County? I know we're testing, but are we able to judge how bad it is in the population? I know at one extreme, yes, but most of the literature suggests that the asymptomatic population is significantly larger than those that require hospitalization.
Right. Recently, the past 4 to 6 weeks, a lot of our infections have been occurring in the younger population, and those are less likely to be hospitalized. But when Elizabeth is going through our data today, you will see that we are seeing even more severe cases in the younger ones. And the number of deaths in people younger than 60 has increased. The number of hospitalization has increased, and she'll be sharing those data with you. I've seen different permutations around the severity index, and that's really asking us to look at the propensity to be hospitalized and the serious adverse effect as the premise for our reasoning. Again, I would make the same argument that for us, we have to be proactive, waiting for those and basing decisions on whether somebody's in ICU or on ventilator, I think is a tad too late to do.
Okay, all right, thank you. Any other questions? Ms. Hanslick.
Yes, thank you, Mr. Chair. I want to acknowledge the receipt, as I think the rest of our commissioners have, several communications in regard to this issue. We did receive a letter from signed by all of the superintendents of the school districts in this area supporting continued mask requirements. We did receive a letter from Dr. Larry Botts, who's the Chief Medical Officer of Advent Health, supporting continued mask requirements. And we also received a letter from KU Health System signed by Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control. And he sent a letter with 2 studies providing direct evidence of effectiveness of masks. So I want to acknowledge the receipt of those communications, which I take very seriously, and appreciate those people taking the time to do that. I've also talked with some folks with the Overland Park Chamber and in terms of businesses, and they indicated that they've had no input from members that the mask mandate is having a negative effect on their businesses. And in fact, when they checked in with their members a couple months ago, the plurality of them indicated that support for the mask requirement. So I just wanted to acknowledge those communications.
All right. Well, thank you. Excuse me, Mr. Brown.
Thank you, Chairman. A couple of questions. Doctor, so I'm going to read something very short. It's 1 sentence long, but this is straight from the World Health Organization. So I'm asking you to help me understand your position on masks relative to what I'm going to read. At present, and I'm reading this right off the WHO's website, at present there is no direct evidence from studies on COVID-19 and in healthy people in the community regarding the effectiveness of universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19. How does that line up? That's straight from the WHO's website, so I'm confused. Can you help me with that?
I would love to have the reference to...
I'm happy to send it to you.
Please do. WHO has been out there, as has been every health organization that, again, CDC director said that yesterday. Last week, directly on a phone call with Dr. Deborah Bax, who is with the White House COVID-19 task force, directly saying exactly the same thing, that mask is by far the most important tool that's available to us. Dr. Redfield actually went a step further yesterday, saying the mask may even be more important to us than the vaccine. So I'd like to see that. If you send it to me, I'll gladly address that with you.
I'm going to email it to you here in a few moments when this presentation's over.
Sure.
I also wanted to address on the business concern. There may be businesses that aren't impacted by the forced use of masks, but 60% of shops, small storefront businesses across America, 60% are out of business or won't be there by the end of this year.
Okay, all right, thank you. Thank you, doctors. We will now move to the public comment portion of this item. Again, at last count, I think we had 50 presenters pre-register. So again, would emphasize the 3-minute time limit, or if you can make your point in less time, please do so. Clerk, would you identify our first speakers?
Daniel Kuhl. Daniel Kuhl. And then the second one will be Anita Parsa. Daniel Kuhl.
Again, I hope you were able to hear my comments outside. Comments will be limited to 3 minutes, or if you can make your statement in less time, please do so. Thank you.
Also, I would ask that all speakers please give your name and address. Thank you.
Morning, Board of Commissioners. Based on your website, I expected 5 minutes. I prepared for this, and I arrived early to make sure I was first so I'd have time. I hope you will hear me out. I will try to keep it brief, though, as much as I can. Again, thank you for having me. My name is Daniel Kuhl. Do I need to announce my address, you said? Okay, 6131 Terrydale Street in Merriam, Kansas. I'm here because I believe there are many things wrong with requiring citizens to wear masks, but I'm just going to focus on one this morning. It's already been discussed a little bit. CDC recommendations. During the early part of this year, our Surgeon General of the United States said, "Stop buying masks," all capital letters, in his tweet. They are not effective in preventing general public from catching coronavirus. CDC and Dr. Fauci were on board with this guidance at the time. Yesterday, in a Senate hearing, CDC Director Robert Redfield said, "These face masks are the most important, powerful public health tool we have. If we did it for 6, 8, 12 weeks, 10, 12 weeks, we'd bring this pandemic under control. We have clear scientific evidence they work. They are our best defense. I might even go so far as to say the face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine." That's a direct quote from him. So if we ignore the about face on policy that has occurred, believe what he said yesterday, we're at 11 weeks tomorrow, so we're almost done, right? That's what he said yesterday. I'm not talking about old information where he said don't do it. Saying yesterday he said do it, but just for 12 weeks, or 6, 8, 10, 12, whatever that means. If we look at what the World Health Organization says, who has not ever changed their position, who has always said universal face mask wearing is not recommended, they warn wearing face masks may give us false sense of security, leading to potentially lower adherence to other critical preventive measures. False sense of security, like saying that it's better than a vaccine, maybe. An article among the CDC's own clear evidence, linked on their website, said where they're trying to prove face mask wearing is important. In this article, it says, "For those who wear a mask for necessity, such as healthcare workers, regular training and fit testing must be emphasized. Whereas for those who choose to wear homemade masks, the requirement of cleaning and changing the mask should be highlighted. Most importantly, lower protective capabilities of homemade masks should be emphasized so unnecessary risks are not taken." So lower protective capabilities, or this is better than a vaccine? Who do we believe, the CDC or the CDC? Yesterday and today. On the CDC website, on that same page, they referenced 19 articles. I could not find one other one besides this one I just quoted that really directly dealt with real people wearing real homemade face masks. This one I quote is from 2013, before this was a political issue. They were not trying to advance a political agenda. They were talking about disease prevention. In practice, people will not wear an uncomfortable mask for a long period. Even if they do, it is unlikely they will wear the mask properly. Improvised homemade face masks may be used to help protect those who could potentially, for example, be at occupational risk from frequent contact with symptomatic patients. However, these masks would provide the wearers little protection from microorganisms, other persons who are infected with respiratory diseases. As a result, we would not recommend the use of homemade face masks as a method of reducing transmission of infection from aerosols. Now, you can look at the other articles on their website. People talked in a box and shined lasers into it and concluded that you should wear a face mask. I don't believe that. This one article is the one that seems to be not politically biased, seems to actually talk about the real issue, not about 3 people in China who had COVID in January. So if we're taking our guidance from the CDC, we're almost done as of yesterday, or we are done. We never should have done it in the first place. Who are we getting our guidance from?
Okay. All right. Thank you very much.
Thank you.
Anita Parsa. Anita Parsa. And then we will have James Buck Firth.
Thank you. My name is Anita Parsa, and thank you for doing this, first of all. I want to start by saying something that's not in my notes, which is I urge you to keep in mind that the folks who have shown up here in Moss may not represent Johnson County as a whole. My impression out there, sitting next to someone who apparently believes that the pandemic is a global conspiracy to bring down Donald Trump, may not be rooted, I think, in fact. I think everyone's opinions matter. However, If you have not read the book of The Death of Expertise, I would urge you all to read it. The premise of the book, written by Dr. Nichols in 2017, is that America has become sort of a choose-your-own-facts adventure game, where anyone who wants to support what they have chosen to believe can go find facts to support them. So we can ignore science, we can indulge in conspiracy theories, and we could simply say, so-and-so agrees with this. Never mind that Dr. Robert Redfield, who runs the CDC, said yesterday, the best prevention we have against COVID is masks. We have a lot of people who are saying, but my freedom. Well, you know, freedom, every one of our freedoms, even those enumerated in the Constitution, is limited at the point which my freedom screws up your life. Every one of them. I can't drive down this street on Cherry going 65 miles an hour because I feel like it, because I'm a free person, because that puts you at risk. I cannot spit in your food if I am a restaurant server because I feel like it, because that is assault. I cannot smoke on an airplane. Every one of our freedoms, however important the idea of freedom is, has some limit. The idea of wearing a mask for the benefit of our fellow Americans is a sacrifice. And I understand, especially the poignant words of the woman who spoke about sexual assault, it is a sacrifice that hurts in some ways. But we have to follow the science, and we have to understand. I'm inspired by an empty parking garage at the Veterans Affairs Hospital where my husband works. It's a garage for the veterans. And every day, my husband walks from his parking spot past this empty parking garage. And after a month of working there, he said, why is this garage always empty? Because those veterans, those men and women, pass it, they park in the patient lot and walk past that every time because they say, Dr. Parsa, I think somebody else might need that spot. I can walk, I can do fine. Those folks know a lot about suffering years or even decades of giving up their personal freedoms, what they wear, where they work, all of those things that our armed services do to serve in this, to protect the freedom of America. They walk past that garage for our freedoms. Wear a mask. Please pass the mandate.
Thank you.
James Buck Firth. James Buck Firth. And then we will have Brittany Vallis.
My name is James.
Do you have a phone? Can you turn the volume off?
James Buck Firth.
That's me.
Like magic.
Thank you.
We're back to the echo.
I even had my phone on off. Oh well.
Okay.
Technology, it's
Thank
amazing,
you.
isn't it?
All right. Your time begins now.
Yes, I am here. James Buck, and that's with a B, Firth, F-I-R-T-H, and I'm a proud resident of Olathe, Kansas. I miss my father-in-law. His name is Gene. I was closer to him than I was to my own father. He died at Delmar Gardens. Due to the virus, I was not able to say goodbye to him. I am now caring for my mother-in-law, Phyllis. COVID is not fair. It is a silent killer. The thought of losing my mother-in-law to this virus and then not being able to see her is a double hit in the gut. That's why I wear a mask. The virus is not a hoax. It is not going away like magic. It is a reckless driver posing a constant danger to anyone. Reckless, and reckless kills. Dr. Ariola said, masks work. Don't drive when drunk. Don't be reckless. Be patriotic. Wear a mask. Vote to extend Executive Order number 2064. continue to make my county, your county, and I quote, the best place to live, end quote, in Kansas. Blessings, peace, and wisdom. May it be so. My thanks to you all. And I also have thank you notes. Pass them along. Keep up the good work.
Thank you.
Blessings be to you all.
Thank you.
Thank
You're welcome.
you.
We have Brittany Vallis. Brittany Vallis. Then we will have Emily Coleman.
Hello again. I'm Brittany Vallis. I gave you my address earlier, still a resident of Olathe, Kansas. I just want to talk for a second, again, about the masks and the virus and everything. Basically, our issue here is the fear of the virus. What could happen, what should happen, what might happen. We don't have a crystal ball. None of us do. None of you do. It's all based on fear of what might happen. So let's look at some data. Let's look at some facts here from the first 100 days before of the virus and then the 100 days after. And the whole point of restricting and doing the stay-at-home order, the masks and all that is to prevent death. Let's remember that, excuse me. That was the goalpost, to prevent death, to not overwhelm our hospital systems, to try to keep that part under control. The first 100 days in Johnson County, we had 63 deaths with 844 cases. The last 106 days since the mask mandate, we have had 8,771 cases, but only 75 deaths. So I'm going to venture to say the number of cases is quite irrelevant, and let's just stop even looking at that number. It's about the number of deaths. I also want to go so far to say this. I am a business owner. I lead a group with 300 plus business owners, and I'm not quite sure where the Chamber of Commerce is coming in at this, but every single time you do one of these mandates, my business plummets because of the fear of the virus, because you are continuing to perpetuate and peddle this fear constantly with a constant reminder of cover your face or you're going to kill somebody. That is absolutely asinine, and as a business owner in your county who chose your county because of the opportunities for our business to thrive, I am asking you on behalf of my 300 plus business owners to not extend this mandate. And one more thing, since I have 1 minute left, your mandate only has power if people listen to it. I have never worn a mask, not once. Your mandate has not affected me personally at all. It will not affect me personally for the rest of my life. My children, my family, myself will never wear a mandate, and I'm not alone. There are thousands of people who are gaining the confidence and the courage to say enough is enough. I don't care about your mandate. I'm throwing my mask away. You're about to see that your mandate has no power because no one is going to listen. Thank you.
Thank you.
Emily Coleman. Emily Coleman. Then we'll have Dr. Robin DeSalto.
I know how this works. Okay. I already spoke to you guys earlier. My name is Emily Coleman. I'm from Spring Hill, Kansas. So this is actually going to be directed to my fellow citizens, and I'm going to be reading from The Politics of Obedience by Etienne de la Boétie. Where has he acquired enough eyes to spy upon you if you do not provide them yourselves? How does he have so many arms to beat you with if he does not borrow them from you? The feet that trample down your cities, where does he get them if they are not your own? How does he have any power over you except through you? How would he dare assail you if he had not cooperation from you? What could he do to you if you yourselves did not connive with the thieves who plunder you, if you were not accomplices to the murderer who kills you, if you were not traitors to yourselves? Resolve to serve no more, and you are at once freed. I do not ask that you place hands upon the tyrant to topple him over, but simply that you support him no longer.
Then you will behold him like a great colossus whose pedestal has been pulled away, fall of his own weight, and break into pieces. No one has the right to muzzle you or your children. Take back your sovereignty and take off your masks. Mr. Brown, that's what anarchy is. Thank you.
Thank you.
Dr. Robin DeSaltol. Dr. Robin DeSaltol. And then we will have Representative Susan Ruse.
Hi, my name is Dr. Robin DeSaltol. I live in Overland Park, Kansas, and I thank you for allowing me to speak today. I treat elderly patients with peripheral neuropathy disease every single day, and I see the negative effects wearing a mask out in public has on our patients. Most of them have their condition because they need more oxygen, and yet our office is required to have signs up to make our patients wear masks. They all want to be compliant, and they come in scared. The masks we give them say right on the box that they do not protect against infectious disease. These are the high-grade masks, and they also say they should be disposed of after each use. So why are we doing this to our citizens? Their health is getting worse daily because of these masks and the lack of oxygen that they allow us to breathe. Not to mention breathing in our own carbon dioxide that we're trying to get rid of. So as public servants of Johnson County, a county in the United States, you have the innate responsibility to protect and defend the United States Constitution. The purpose of the Constitution is to prevent government outreach and protect citizens from actions of government officials that are acting outside of the law. Since July, the Johnson County Commissioners have been acting outside of the law. You've been requiring a medical intervention for Johnson Countyans by requiring them to wear a face mask. Kansas law requires a license to practice medicine to make medical interventions. Further, Kansas law requires examination by a licensed practitioner prior to a medical intervention to determine its appropriateness. Kansas law also requires the permission or informed consent of the person receiving the medical intervention. Not one of the medical commissioners has medically examined me or anyone else I know to determine that wearing a mask is the best course of treatment for me. There's been no informed consent between me or anyone I know or any physician regarding the use of face coverings. You have no medical training or medical license to make determinations regarding medical interventions, nor are you insured for such treatments. Doing so without training and a license is illegal in the state of Kansas. Consulting with the doctor does not validate your decision to require this intervention for me or any other person. Each person would need to be examined by a licensed physician on an individual basis. Regardless of what is decided by the governor, no public servant has the authority to force any person to accept medical intervention that is not authorized by the person receiving the intervention. You're being put on notice that you're acting outside of the law by practicing medicine without a license, and this needs to stop immediately. I sincerely thank you for your service to our community. However, please understand that continuing to act in a manner that is inconsistent with the law puts the county at great risk of liability. Thank you.
Thank you.
Representative Susan Ruse. Representative Susan Ruse. Then we will have William Featherston.
Hello. Hello, Commissioners. I'm here to speak in favor of the mask mandate. Commissioners, this is about lowering our risk of catching the virus and is about saving lives. I don't understand the reasons behind turning the wearing of the mask into a symbol of division between political parties, supporters and non-supporters of the president, between those who believe in science and medicine and those who don't. And frankly, it doesn't help and actually causes deeper division when an elected official speaks of taking up arms and preparing for a civil war. I don't just speak as an elected official, I also speak as a Latina, and I want to inform you that the pandemic has disproportionately impacted Blacks and Latinos. Some of that is due to lack of medical care. It is easy to forget them when they're not here to speak for themselves. But I'm here to represent my community. Commissioners, mask saves lives, period. It's about science, not politics. And it is foolish and unethical to disregard science and the medical community. Thank you.
Thank you.
William Featherston. William Featherston. Then we will have Tony Gillett.
County Commissioners, thank you for this opportunity to speak. My name is Dr. William Featherston. I'm an emergency physician living in Overland Park. I'm here to support the continuation of requiring the use of face masks for control of the spread of the coronavirus during this worldwide pandemic. Just yesterday, Robert Redfield, the CDC director, testified to a Senate panel that masks are, quote, the most important, powerful public health tool we have. Recent spikes in cases at the KU and KSU campuses reveal how quickly the virus spreads in situations where masking and school distancing are not occurring. I wear masks 10 to 12 hours a day alongside my fellow physicians, nurses, and the rest of the hospital staff. They might be inconvenient, but they don't lower one's oxygen levels, they don't raise your carbon dioxide levels, and you certainly aren't breathing your own germs. Our ER has been seeing COVID patients daily. As of 2 days ago, the 7-day rolling average of new cases in the KC Metro was 270, and that's with a mask mandate in place. If we get rid of the mask mandate, the virus will continue to spread even worse, and our hospital systems will be overburdened. To those that say it's only a virus, remember that there are known viruses that have lifelong effects, such as HIV, the herpes virus, and also chickenpox and shingles. We know that COVID causes fatigue, coughs, joint pain, and shortness of breath that goes beyond the initial illness. With only 6 to 8 months of data, we are already knowing that long-term effects include lasting damage to the heart muscles, scar tissue in the lungs, blood clots, brain changes, and there's a lot more that we don't know yet. So, until we have a vaccine with at least 65% people immunized, the mask is the best public health tool that we have. Thank you very much.
Thank you.
Tony Gillett. Tony Gillett. Then we will have Dave Spafter.
Good morning, Commissioners. Thank you for your service to our citizens and to our county. My name is Tony Gillett. I live on 60th Terrace in Shawnee, Kansas. Today is the 217th day of the 2 weeks plan to slow the spread and flatten the curve. That's right, 217 days by my count. So 200 days later, here we are. Our hospitals are not overwhelmed, but we are stuck in fear. Fear. That's right, fear. So today, on Constitution Day, we are here to remind you that you represent us and not control us. You took an oath to defend the Constitution of our country and of our state. Your job is to protect our rights. It's also time for self-government and to protect those rights again. I refuse to comply with the Great Reset, the Great Global Reset. This is a mind-controlled device. This is tyranny. End the mask mandate, please. This is tyranny. It is time for us to get back to a real normal. Do that now. This used to be the land of the free and the home of the brave. Let's embrace that again. Thank you.
Thank you.
Excuse me, we will now have Mary R. Cawthon. Mary R. Cawthon. After that, we will have we will have Amy Hartman.
Hello. My name is Mary R. Cawthon, and I live at 14059 South Mullen in Olathe, and I've been there about 40 years. I'm going to read what I've got here. The science of masks is far from settled. Dr. Jeffrey Klausner, an infectious disease doctor at ULCA, described mask wearing as all psychological and not physiological. He told the LA Times that fear spreads a lot faster than a virus and that masks only make you feel better. Masks, and I have thought this from the very beginning in March, that they are a false security. And I think that's sad for people who wear masks and think that they are secure. Non-pharmaceutical measures for pandemic influenza in non-healthcare settings, personal protective and environmental measures study per the CDC states, quote, in our systematic review, we identified 10 RCTs, which are randomized controlled trials, that reported estimates of the effectiveness of face masks in reducing laboratory confirmed influenza virus infections in the community from literature published during 1946 through 2018. In pooled analysis, we found no significant reduction in influenza transmission with the use of face masks. Our systematic review found no significant effect on face masks on transmission of laboratory-confirmed influenza. Although mechanistic studies support the potential effect of hand hygiene or face masks, evidence from 14 randomized controlled trials of these measures did not support substantial effect on transmission. The size of influenza virus particles is 18 to 120 nanometers and is comparable to that of COVID-19 60 to 140 nanometers. I don't have time to read the rest of this, but I just want you guys to know that we are really getting tired of seeing masks, and we don't really believe that they do any good. I don't know, false security, does that not sound like something you might want to check into for yourselves? Don't take our words for any of this, but try to do your own research without biased opinions, like, you know, it's out there on a lot of the newscasts. And so please hear what we're saying. There's a lot of us that hate masks. I mean, if anybody wants to wear them, that's fine, but we don't like to be forced to wear anything on our bodies, especially out in public. This has never happened before, and I think that's unprecedented now. Thank you very much.
Thank you.
Amy Hartman, and then we will have Heather Ousley.
Hello, thank you, Commissioners. I appreciate your time. I'm going to be really short. My perspective today is from
Excuse me, please give your name and address, please.
Amy Hartman, 10819 West 140th Terrace, Overland Park. I come to you from science. I come to you as a person that is not afraid. I'm nervous, but I'm not afraid. I don't mind wearing this, and I see it as a public health tool that's inexpensive. I want our schools to open. I want these kids out here to go to school. I just think we have to have a precaution. This is nothing. I think if we give the expectation to our students that yes, we have to wear it during school is great. I'm a substitute teacher. I don't want to get sick. I'm 50 years old. So I want to go to school, but I want precautions. And I think the best tool we have is a mask. And also, I think you have to understand the mask is not 100%. We all know that. But what it does is it lessens the viral load. So when you get less virus, you get less sick. So if we all wear a mask, we go to school, we keep our organizations open. I want the economy to stay open. I think we all just need to wear a mask. Let's go into our restaurants. Yes, we eat, we put it back on. I want to go into and buy things. I want to go to Target, Walmart. I want to go to all the small little stores too. But I think if we just keep a mask on, we can do that. And it's a very small thing to ask. And it's not anything that is, I think, oppressive. I think it's a very common, nice thing to do for yourself and keep the viral load down, and we might get a little sick, but I think that's what we want. We just want to get a little sick. We don't want to get really sick and go into the hospital. But if we wear a mask, we're just going to get the viral load just a little bit, and that's okay. We don't get very sick. And secondly, the asymptomatic spreaders. Oh my gosh, if I am teaching little kids, they're not going to get very sick, but I could potentially get super sick. And that's where I have a really hard time with people that don't want to wear a mask when it really is something that is simple, we can all do together. Let's not be afraid. I don't want to be afraid. I think if we just wear the mask, We can keep our businesses open. We can all go to school. We can keep the economy going. I think that's what we want. And I think we can do that with precautions. Precaution is a mask, any mask. And I think we've had some, I think the government kind of said, or people around town, oh, it has to be a specific mask. I think at this point we just say cover your mouth. Cover your mouth and nose. Let's just do it correctly. And I have one other thing to say. And people are saying masks don't work. Mumbai, India, people are living on top of each other in the slums. Their death rate is extremely low. Their infectious rate is extremely high, but they're not dying from it. And why? They're not getting a viral load that's going to kill them. They're getting sick. Just like if we look at our death rate and infectious rate, our infection rate might be high, but sometimes we just need to look at also the death rate and the viral load, which will keep us safe. We might get sick, but we're going to stay open. And if we wear a mask, we're not going to go to the hospital. It's just a simple tool. I want to open schools and I want to open businesses. Just put a mask on. Thank you.
Thank you.
Heather Ousley. Heather Ousley. Then we will have Bill Jacobson.
Thank you, Commission. Thank you, Mr. Chair. My name is Heather Ousley. I'm the president of the Shawnee Mission School District.
Let me ask you this. If you feel comfortable removing your mask behind the barrier, we do have a hearing issue on our dais.
Unfortunately, I do not feel comfortable removing my mask.
Thank you.
Thank you. I am here on behalf of the Shawnee Mission School District and our fellow districts here in Johnson County. We have provided you with a letter. I have copies here I can leave with your board clerk. We are requesting that you vote to continue to require the face masks to be worn in indoor public spaces or in situations where social distancing cannot take place. We collectively represent almost 100,000 public school students in the county, and we strongly believe that a public face mask requirement is critical to helping decrease the prevalence of COVID-19 in the community in order to keep our students, staff, and families safe. Our communities are desperate to have our schools open and students safely back in class. Unfortunately, our county has struggled to control the spread of the COVID-19 virus in the community, and this spread has made it difficult to make progress towards getting all students back in school. There is broad consensus in the medical and scientific community that wearing masks is critical to stopping the spread of the virus. We are not defenseless against COVID-19, said CDC Director Robert R. Redfield. Cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus, particularly when used universally within a community setting. All Americans have a responsibility to protect themselves, their families, and their communities. Our districts are committed to implementing the public health measures, including mask wearing, social distancing, and proper sanitization procedures recommended by the Johnson County Department of Health and Environment to keep students and staff safe. However, this is a community-wide challenge, and none of us can do it alone. Please help us by continuing the county-wide requirement that face masks be worn in indoor public spaces and in situations where social distancing cannot take place. It is signed directly by all 6 superintendents and all 6 board presidents. Thank you so much.
Thank you.
We now have Bill Jacobson. Bill Jacobson. And then we will have Carrie Parsons.
Hello, Commissioners. Great to see you. I know part of the intro here is to say where you're from, and I'm happy to share that with you today. So, I was born in 1964 in a small town called Overland Park, Kansas, and it was amazing. I was blessed by God, my parents, and my ancestors to be born in the land of the free and the home of the brave. We said the Pledge of Allegiance every day, and schools taught us about the amazing rights and freedoms this country offers to anyone who has a dream. We respected the rule of law. We looked up to those who deserved our admiration: police officers, firefighters, teachers, and yes, even some politicians, sometimes. People looked after themselves, and they took it upon themselves to look out for others. There was a real sense of community. People were always smiling and said hello to everybody. Kids roamed freely without fear. Crime was low. People left their doors unlocked, and government was small. Two things happened since then. And if we fast forward to 2020, one, the new virus surfaced that we knew very little about, creating fear and uncertainty. Second, our local government got big, really big. So-called experts predicted 2 million people would die. Local governments forced shelter-in-place policies, closed our schools, restricted our businesses, blocked our church services, restricted our travel, and enacted mask mandates. Let's fast forward to right now, today. Well, we know the so-called experts' doomsday predictions were completely wrong. The virus was substantially less deadly than predicted, and the people it affects almost exclusively the elder with existing health conditions. And the 99% of the majority of the people in Johnson County have minimal risk of death from this virus. We also know by looking at all the research and data that almost all the restrictions and mandates had little or no effect on reducing the natural course of this virus. For example, the lockdowns in the U.S. did not reduce the deaths per million any better than countries that did not lock down at all or had less restrictive mandates. And the mask mandates, as proven and shared in this forum multiple times, did not drive any lower transmission or death rates than non-mask counties in this state. And that is directly from statistics from the KDHE. So, now that we know that this virus poses little to no risk to the general public, it's time. It's time to move from fear to freedom, and lift this outdated mandate and bring back this amazing city. And I'd like to make one more comment here to Mr. Allen. Mr. Allen, great moments are born out of great opportunities. And what you have here is a great opportunity. An opportunity to demonstrate for everyone out here and everyone in this county that you can vote independently and not follow Mr. Eilick every time.
You addressed the
Excuse me. Yes, you need to conclude your comments. Thank you. Mr. Allen.
Chairman, I think I've about had enough of this. I've been an elected official in this county for over 31 years. I was in Shawnee politics for 19 years, 11 years as the mayor. I owned and operated a multi-million-dollar insurance agency for 37 years. I have a master's degree in business and finance from Rockhurst University. I have made thousands of votes as an elected official, and to insinuate, and I can see the game that's being played, you've got me figured supposedly as a swing vote. I am an independent person. I will vote and always vote what I think is best for this county. Thank you.
Thank you. Next, please.
We have Carrie Parsons. Then we will have Joanne Perrin Sunschuer.
Hello, I'm Carrie Parsons. I live at 6358 Hilltop Street in Shawnee. And I want to share with you the map of the counties in Kansas that rejected the mask order. The red are the counties that rejected the mask order. Johnson County, according to what I read just late last night,